First, any apologies? Draft minutes, pages 3 to 6. Members content their record. Agreed?
Agreed.
Yeah.
Remember, summary table requests for information from department, pages 6 to 8 for noting. Move on to the first briefing. Can refer members to pages 8 to 20 of your tabled papers. We'll move straight into the first session. Morning.
Good morning.
Welcome. Members, come up to the meeting. Dr. Elizabeth Mitchell, Director of Development and Capacity Building, Mrs. Teresa Keating, Public Health Development Officer Policy, and Dr. Joanna Purdy, Public Health Development Officer Policy 2 from the Institute of Public Health. Do you want to perhaps start by giving us a brief overview? Members
Yes.
who received the paper from the Institute, just to perhaps talk them through that to start with, then we'll go into questions and answers.
I hope everyone received the paper that we sent. Just to thank the committee for inviting the Institute of Public Health to give evidence today on measures to promote health and well-being in the workplace. I'd like to start just by introducing my colleagues Joanna Purdy and Teresa Keating and just explain what their areas of expertise are. Joanna's experience is primarily in the field of food and nutrition, but she also has done a lot on active travel. And Teresa's expertise covers active travel and the health impacts of education and employment. By way of introduction, just a few words about the Institute. We support policymakers and practitioners in working for the public health across the 2 jurisdictions in Ireland, and with a particular focus on health inequalities. At the heart of our approach is the importance of action across the social determinants of health, such as education, employment and the environment. In my presentation, I'll outline a few of the key areas relating to health and wellbeing measures to reduce sickness absence. Firstly, why is workplace health important? From the employer's perspective, a healthy workforce is needed for the effective delivery of services. Sickness absence decreases productivity and has significant financial implications. The main causes of sickness absence in the public sector are mental health problems and musculoskeletal conditions such as back pain. Chronic long-term conditions such as heart and chest disease and diabetes are also significant causes of longer-term absence, particularly in older workforces. Mental ill health accounts for about 29% of the total in the Northern Ireland Civil Service of sickness absence, and it's also a similar proportion in the health and social care sector. Turning to evidence of what works, workplace health and wellbeing interventions cover a range of key issues such as health and safety, mental wellbeing, lifestyle behaviour change and organisational good practice. I'll not be covering health and safety at work today, although this is a very important aspect. Evidence as to what works has recently been reviewed in a report looking at the effectiveness of interventions to improve workplace health and well-being. The authors concluded that approaches to improving the health of employees are effective in a number of areas. Health promotion and wellness programmes, especially those multi-component programmes covering a range of lifestyle issues, for example physical activity, diet and smoking cessation, appear to be the most effective, at least in the short term, especially if they're designed in collaboration with staff and with the support of senior management. With respect to mental health programmes, the evidence is strong for interventions to reduce stress in the workplace, and there's also moderate evidence in the short term for interventions targeted at people with an existing diagnosis of depression. For back pain and musculoskeletal problems, although there are a number of clear and promising interventions, the evidence for effectiveness does not appear particularly strong at present. I'm going to highlight some of the areas for action, starting with physical activity. By way of context, the percentage of adults in Northern Ireland achieving the Chief Medical Officer's recommended levels of 150 minutes of physical activity per week has reduced from 38% in 2010 and 11 to 35% in 11-12. It has also been reported quite widely recently that our population has currently the lowest levels of cycling and walking in Europe. The easiest and most acceptable forms of physical activity are those that can be incorporated into our everyday lives, such as brisk walking and cycling. Increasing the levels of physical activity reduces overweight and obesity and has additional benefits for heart, musculoskeletal and mental health. There are many opportunities for promoting physical activity in the workplace, some of which have no or very little cost, including simple prompts to increase the stair use rather than lifts, involving employees in organising workplace activities such as walking programmes, yoga, dancing, whatever activity they're interested in, supporting discounted membership of local gyms or leisure facilities, and encouraging staff to walk or cycle to work. A brief word on the Cycle to Work scheme. This provides tax relief on purchase of bikes and cycle safety equipment, saving on average the cost, about half the cost. It's a very worthwhile initiative, but it's only part of the solution to increasing cycling to work. There's a need to ensure better access to secure weather-protected cycle racks and to changing facilities and showers in the workplace. In addition, we need to address concerns about the dangers from road traffic. Overall, really, Northern Ireland needs to develop a safer cycling infrastructure. This will require an integrated policy approach, including planning and financial implementation, as well as monitoring and evaluation. The second area of interest is the healthy eating in the workplace. And again, just a couple of facts. According to the most recent health survey findings in 2012-13, 37% of adults in Northern Ireland were overweight and a further 25% were obese. So that's nearly 2/3 of the adult population are either overweight or obese. So promoting healthy eating is an important aspect of any workplace health programme. Key to this is the provision of healthy eating choices in workplace canteens and other outlets. A very good example of a local policy is the Food in Schools policy, which was developed last year, published last year by the Department for Education and the Department of Health and Social Services. And this is aimed at creating significant change around food provision and the promotion of healthy eating in schools. Also of note is the Calorie Wise scheme, which the Food Standards Agency in Northern Ireland piloted in 2012 in a number of food premises, including 3 of the local health trusts. The aim is to provide consumers with more information about calories in the different foods on offer in catering establishments, so they can make informed choices. Another local example of good practice is that the Food Standards Agency of Northern Ireland, in conjunction with DFP's Central Procurement Directorate, has updated existing procurement guidance on integrating sustainable development into the procurement of food and catering services for the public sector. The final area I want to highlight is mental health and well-being in the workplace. And again, a couple of facts. 1 in 4 people will experience a mental health problem each year. Mental illness is the single largest cause of disability. Risks posed in the workplace to mental health are not as visible as those posed to physical health, but they are no less serious. For employers, the benefits of workforces with good mental well-being include enhanced job performance and productivity, increased commitment and job satisfaction, staff retention, and lower levels of absence. So what can employers do to promote a positive work environment and reduce stress at work? As a basic building block, employers should have policies in place to improve working conditions, for example, human resource policies that cover health and well-being, work-life balance, and preventing bullying and harassment in the workplace. To encourage early detection and intervention, raising awareness and understanding of mental health issues among managers and the rest of the workforce is also very important. Practical support for people with known mental health problems, including appropriate measures for disabled members of staff or those returning to work after a long period of absence. Stress management programmes and what is provided will vary according to the settings and the nature of the work. And many organisations avail of employee assistance programmes, often provided by external agencies. In conclusion, the benefits of improving health and well-being in the workplace extend far beyond reducing the cost of absence or poor performance. The key message is that systematic, coordinated, comprehensive approaches which involve staff in planning and senior management support are essential for promoting health and well-being in the workplace. Creating an environment where people actively choose to walk and cycle as part of everyday life can have significant benefits. Employers can do their part to support this. Real improvements can be achieved when active travel is integrated into transport planning and ultimately will have a positive effect not just on our environment and on the workforce and the population, but also on the economy. The implementation of healthy eating in the workplace has been shown to be more effective when it's delivered in conjunction with other health-promoting activities, in conjunction with links with other external agencies and consultation and engagement with the main parties involved. Most employers now recognise that poor mental health is by some margin the single most important cause of sickness absence in the workforce. They acknowledge the importance of having proactive programmes in place. The Institute would like to make the following recommendations to the committee. We think that to promote and maintain a safe environment for active travel to work, pedestrian and cyclist safety should be a key focus of infrastructural investment. The work of a broad range of government and other agencies will be required to achieve this. In addition to the Cycle to Work scheme, further uptake of active travel to work could be facilitated by the increased availability of secure, weatherproof cycle parking facilities, and not just at workplaces but also at schools and at public transport hubs, and by access to changing rooms and showers. The principles and learning of whole school approaches to healthy eating could be adapted for workplaces. 2 practical measures to support staff in eating more healthily in the workplace could be implemented across the Northern Ireland Civil Service and the HSC. These are the implementation of the procurement guidelines that I mentioned and the rolling out of the Calorie Wise scheme in staff restaurants across these organisations. Public sector employees should ensure that they have comprehensive programmes in place to promote mental health and well-being and to support employees with mental health problems. That's the end of the formal presentation, and we'd be happy to answer any questions.
Thank you very much, Dr. Mitchell. I think this is quite interesting. I mean, I think members in the committee perhaps have taken a narrow view about sickness absence rates in the past and how you deal with it. So this provides a more holistic view of it in terms of the factors that affect staff rates of health, environment, transport options, eating, smoking, work-life balance, all huge issues. And I suppose we need to take those into account in regard to how we reduce these absence rates as well. I'm wondering, Dr. Mitchell, can you give us some examples? I mean, in terms of the improvement to pedestrian and cyclist safety, is there any examples of areas? There's always the same cities are always rolled out, your Copenhagen's and your Amsterdam's and so on. But I'm thinking in Dublin has introduced a new cycle scheme within the city. London, the most obvious example. Also places like Cambridge. How have their public services, how have their employees' health rates improved as a result of that improved infrastructure?
Okay, I'll ask Teresa, who is based in Dublin, to come in and speak specifically about Dublin. But I'll also ask Joanna, because she attended a workshop on Monday organised by Healthy Cities, which actually highlighted some of the benefits from Copenhagen. So maybe we'll start with Teresa, if that's okay, talking about the experience in the south.
Yeah, certainly. I mean, we have a number of schemes. I'll talk about Dublin in particular. So the Cycle to Work scheme has been in place for a number of years, similar to the scheme in Northern Ireland, where there's a tax incentive to purchase a bicycle. There has been no formal evaluation of the cost effectiveness of that scheme in Dublin. However, cycling rates have improved significantly in the 5 years from 2005 to 2010. Cycle rates had increased by 35%, and I think the evidence of the number of new bicycle shops has been quoted as one of the positive spin-offs, I suppose, of that scheme as well. Cycling is certainly by no means particularly safe in Dublin. However, some other infrastructural and policy changes, for example, the 30 km/h speed limit along the quays has made significant improvements to cycle safety. And I think just general driver awareness and education as well. There's been quite a big campaign through the Road Safety Authority just to promote and recognise cyclists on the road. There has been a number of infrastructural changes, but I think it certainly wouldn't be held up as a gold standard as we might hear from other places. I suppose just one final thing to note is the Dublin Bike Scheme, and just looking at how that might be implemented in Belfast and the benefit that might have. Obviously recognising that a lot of commuters have long car journeys or long journeys to travel to work, but one of the benefits in Dublin of the bike scheme is that a lot of the hubs are located near transport exchanges, so there is the possibility to bus or train and then hop on a bike for the remainder of your journey, particularly if you work, in a place close to a hub.
And Joanna, maybe could tell us a little bit about the learning from Monday's workshop?
Yes, thank you, Liz. Just to build on your point about many of the European cities are cited as good examples of best practice in terms of cycling infrastructure, and again to draw on work from Copenhagen that was presented on Monday. 36% of the workforce commute to Copenhagen by bicycle. They've seen an increase of 10% in cycling in the last 10 years, and many of those increases have come about through the structural changes that they've implemented, widening the cycle lanes and in fact putting structural barriers in place to protect cyclists from motorists as well. Teresa mentioned the reduction in speed limits, and that's another feature of the Copenhagen system, where they have a 20 km/h speed limit in place in rush hour, which obviously facilitates cyclists much better. But what's important and emerging from the cycling in Copenhagen is the fact that they are reporting, based on the number of cyclists cycling to work, cycling for work and study purposes, reduces overall mortality by 3% and has led to an increase of 5 years in life expectancy. Those are important health benefits emerging from the lifestyle and commuting changes which have been brought about as well by those infrastructural developments.
I think it's worth highlighting, Chair, that the level of cycling in Northern Ireland is 1%, compared to 36% in Copenhagen cycling to work. And the 1% is just overall cycling levels, so I think we have a fair way to go.
And the figures within the report as well, I was looking over them last night, see if I can find them. 150 minutes recommended physical activity per week is reduced from 38% to 35%, and the population has the lowest level of cycling and walking in Europe. I think that's an appalling statistic, and we have the debate so often about the obesity time bomb that we're facing. Well, it doesn't seem to be getting any better in the previous 3 years anyway, going from that. Just to move on to another point as well, there was reference to various guidances. DFP Central Procurement Directorate has updated procurement guidance on integrating sustainable development into the procurement of food and catering services. In terms of food and catering services, I mean, I think that we sometimes pay lip service to healthy eating. So you can go to an event in the Long Gallery about healthy eating, and then at the end of it you can have a reception with sausage rolls and chicken goujons, which doesn't really make sense. So I'm just wondering, is guidance enough? Does there need to be something put on a statutory?
I suppose there's always a debate about this, is guidance enough? And then I think you get into the arguments about adults should be able to make their own choices, and so I think there's a balance to be achieved here, but I think we can do a lot through effective implementation of these guidelines, which will be aiming to increase the healthiness of the ingredients and the materials that are purchased throughout the catering services in the public sector. So that means, you know, without even having to think about it, you're actually automatically making things a bit healthier, either by reducing salt content or lower fat or sugar content. So I think that makes things easy. I think the other scheme which we also mentioned was the Calorie Wise, and I think that's important too, because it gives you information as consumers to make your own choices. So you maybe been eating something quite happily, and then if you've got information on what the calorie content of that food is, you may think to yourself, wow, I didn't realise that, you know, I'll look for something a bit more healthy today. So I think information is key, and I think rolling out that Calorie Wise scheme would also...
Can you just elaborate on that a bit more? I'm not sure if members...
Yes, and I'll maybe ask Joanna to come in and expand on it as well. It was developed by the Food Standards Agency, and in Northern Ireland, the FSA for Northern Ireland has conducted a pilot in 2012, and I think it was 12 catering establishments. Some were private sector, and some of them, 3 of them, were the Health and Social Care Trusts who used it in their staff restaurants, etc. And it has, as far as I know, evaluated well, and there are plans to roll it out across in Southern Ireland as well as in Northern Ireland. And some of the Health and Social Care Trusts who implemented it as a pilot have continued to operate it since the pilot ended. Further work has also been done by Food Standards Agency here and the Food Safety Authority of Ireland on helping catering managers to work out what the calorie content of food is. So that will be a tool that will be available to help with the implementation of this. And I think a very simple recommendation would be to roll that out progressively across the public sector in Northern Ireland in their staff restaurants and canteens. But anything else to add, Joanna?
Yes, just to add 2 points. One would be in relation to the actual rollout of the scheme in terms of how caterers and catering establishments will be supported. The Food Safety Authority in Ireland, in conjunction with FSA Northern Ireland, have been working very closely in developing the calorie calculator, which is the tool that caterers and catering managers and companies will use to actually work out the calorie content of their menus, because that in itself is a very complex process, and when you get down to the nitty-gritty of how much oil is actually absorbed in the various cooking processes or fat that may be released as well, makes it a very complex process. So they've worked very hard at developing this particular tool. The tool is due to be launched by the Food Safety Authority in Ireland in April, and that will follow in Northern Ireland and no doubt the rest of the UK, certainly in Northern Ireland within the next year. Most likely this calendar year, and then across the UK. And in fact, the Food Standards Agency, Northern Ireland and FSAI in the Republic really are leading on this, and they see this as kind of being setting a trend in terms of being a global tool that will be available for calorie information for consumers. What's also important, just to pick up on the point about catering established, particularly in the health and social care sector, the Calorie Wise scheme has been rolled out in those restaurants that are obviously open to both employees but open to visitors as well, and day patients using hospital and health and social care facilities. So not only is the scheme applicable to those who are using on a regular basis, but to the wider population as well. So it's helping consumers make informed choice. I think that, coupled with broader issues such as front of pack nutrition labelling, are all contributing to a greater awareness of what we are eating and making an informed choice around our food, both in the supermarket and in catering establishments.
Okay, John?
Thanks, Chair. I suppose several points, just even following on from the Kieran, you look at that. I mean, I was last as a visitor in Craigavon Area Hospital when my son was born 9 or 10 weeks ago, and the food now, I have to say, on offer I didn't see any sign of calorie-wise, and the food in the offer was pretty well chips. I can't leave them. And I think even, wouldn't mind some of your comments around vending machines. If you even walk around this building, you don't have far to go to be tempted into to vending machines. As to where that has that a role? And I accept, Elizabeth, your point that you're probably trying to find this balance between the nanny state becoming this sort of all-encompassing body and how we improve health. Also, wouldn't mind your comments on how we're managing long-term conditions and how we're helping people with long-term conditions manage those conditions in a better way. Also, in the mental health, there's been some, when I was a member of the Health Committee, there was a lot of talk about how you would do sort of almost like first aid for mental health. Have we made any progress at rolling that out, even within the ordinary civil service, never mind large private sector employers? And I suppose the role in absenteeism around people who have other caring responsibilities, particularly, parents or maybe looking after an elderly relative, that is bound to have a knock-on effect on our absenteeism. Is that coming in to our sickness figures, or are we counting those separately? Just a few thoughts, Chair, to get you.
Get us going there. Thank you.
Judith has a degree in nutrition, so she was telling me all about this.
Oh, good.
Clearly, I don't pay attention.
I'll just pick up I'll probably do them in reverse order here, if that's all right. Care responsibilities. I think it's widely known that there are higher levels of sickness absence in female staff, who also the main burden of caring often falls on them as well. And I think there's no doubt that hidden within the sickness absence figures, there are probably elements of people having to take time off for caring responsibilities. I think that can be addressed through increasing access to good childcare and also support in terms of caring for older or disabled family members.
Of course, there's a time when if you have a child sick, you can't go to it.
Yes, and sometimes
childcare, and
exactly. Sometimes that's a problem. So there are difficulties definitely around that, and I think family-friendly policies, employers that understand working responsibilities and allow flexibility can help with that as well. Mental health first aid, it has been rolled out quite widely, particularly in the health and social care sector. For example, the ambulance service have been rolling it out for their staff and finding benefits not only in terms of their ability to deal with the people that they are, the service users, but also engagement with other members of staff. So there are definite positive benefits from that. There are a lot of trainer organisations providing training in mental health first aid and similar schemes which help people to talk and raise the issues of mental health, increase awareness and how to respond, and help to signpost on then to other services.
Just on that, Elizabeth, if I could ask, Chair, we've battled, I suppose, for many years now over the stigma around mental health. I mean, are we making progress in that? Is there still a reluctance for some employers or some employees indeed to say they have a mental health problem, almost hiding it behind something else because of either they think it's a long-term difficulty or somebody's going to be very problematic to deal with in the workplace? I mean, is there what sort of evidence around the mental health issue?
I think there's quite a lot of evidence that there is still significant stigma about mental illness, not just in the workplace but in wider society, and there have been a number of high-profile campaigns organised by various organisations, some of the community voluntary sector, by the Royal College of Psychiatrists, and indeed work done by the Public Health Agency. They'll be aware of their campaigns using high-profile celebrities, local celebrities like Linda Bryan, to highlight that mental health problems can happen to anyone, and also recently then trying to using people who are in high-profile sports personalities and players as well across the range of sports here, to, again, using boxing as an example, because men often have keep their mental health problems to themselves, perhaps more than women do. So a number of things happening on that, and the Public Health Agency doing work on that. Just also worth mentioning that the Department of Health, Social Services and Public Safety, in producing a new suicide prevention strategy, will be broadening that out to include more aspects of positive mental health promotion, and one of the sections will be on promoting mental health in the workplace. So that will provide a strong strategic context for this work going forward. If I could pick up on your next point, which was on what are we doing about chronic conditions. Again, I could maybe refer to the Condition Management Programme. This is a programme that has been funded for a number of years by DEL, the Department of Employment and Learning, since 2007, and it offers work-focused health rehabilitation to individuals living with a range of physical or mental health problems and who are in receipt of sickness-related benefits. The programme is delivered regionally by a range of HSC, healthcare professionals, occupational therapists, physiotherapists and mental health nurses. And currently, 2 of the trusts in Northern Ireland are also offering a pilot of this to job seekers allowance claimants with health conditions. And there also has been a pilot for DEL via the Welfare Department, extending this to civil servants. And some of the trusts have been extending it to their own staff as well. The type of services that are provided through this, it's usually a 12-week programme, and they provide things like helping people to understand their condition, improve their functional ability, increase confidence, to improve the prospects of returning to work or staying in work. It provides advice sessions which can cover things like self-esteem, confidence building, assertiveness skills, stress management, pain management, fatigue management, managing anxiety, managing depression and lifestyle management. So quite a big focus on the mental health aspects and also managing chronic pain. And I think one of the things about this is that I think we should be trying to get this in earlier. Often there's been a tendency to wait until people have been on benefits or disability for 6 months before offering them the programme. And I think these pilots where we're trying to give it to people who are perhaps still actually in work, so that we're supporting them to stay in work rather than going off work, are the way to go for the future. And I think this is a promising area for future.
Good. Also, just, Chair, finally, on this point, leading on from that, what impact does waiting lists and times like that in the health service have on the length of time people are off work? Mental health issue, if you have to wait 6 months or a year before you see somebody, or even on a physical condition, you have a bad knee, and you have to wait that's bound to have a knock-on effect on.
I think inevitably you're right that this long waiting lists may have an impact. I think priority often has to be given on the basis of clinical need, so the people who are suffering most need to be seen first. But I think if cognizance can be taken of people's circumstances, some employers provide schemes where they either provide access to diagnostic facilities or indeed to intervention procedures so that they can address that problem.
Thanks, Chair.
Thank you. Thank you very much, and thank you for your presentation this morning. I can apologise for being slightly late. It's in connection with a culture which probably has built up over many years, and as far as Northern Ireland is concerned, the number of people who are prescribed antidepressants who not only seem to be on them for a short period of time, but there seems to be a sort of a repeat prescription approach where it's a lifelong condition as opposed to maybe trying to deal with the source. Has there been any work undertaken? Because I appreciate that it is one of the areas where we are having more people out of work because of stress and as a consequence of that, they say that they need antidepressants to deal with it. And the number of people who are getting prescribed fluoxetine or whatever else, and they're on it for life, you find that many of us end up dealing with people who have lost their job, doing appeals for them because of that. You end up doing a DLA appeal, and we find out that they went off with stress out of work, and as a consequence of that, they've never been back to work. I'm wondering, has there been any work done in relation to dealing with GPs and how they seem to just reach for the prescription pad and dish this out as a rule to sort all their problems? Yes, it probably does take it away from their door for a period of time, because the person's probably in a fairly zoned out position for quite a while.
I mean, you're quite right. The levels of antidepressant prescribing here are high compared to the rest of the UK. And this is something that is being tackled.
Not only UK, worldwide, we're one of the highest.
We are certainly high. I think in terms of the workplace, I think what increasingly is being recognised is that programmes like cognitive behaviour therapy, so sort of like a talking therapy, should be offered as an alternative. And I think early intervention, rather than waiting till people go off with stress, so trying to bring in stress management programmes and support employees through that route are important as well. The cognitive behaviour therapy is interesting. It can be provided by an online programme, or either on its own or in conjunction with a therapist. Has an overview of the CBT online, and that means that a therapist can actually support a large number of people who are maybe going through the programme online, just with some direction from the therapist, rather than taking up a lot of time for individual therapy sessions. So I think that's a promising area, and I think it can be provided. It has been trialled in Northern Ireland. It is available. Beating the Blues is the programme that's been used. So I think that's another promising area to try and address this issue of high levels of antidepressant prescribing. That's one angle. I think the other angle, which the Health and Social Care Board will be taking forward, is in terms of GP education and support. And having access to talking therapies for GP is an important angle to that. So if they have something else they can refer patients to, rather than reaching for a prescription pad, that will be part of the solution.
Looking at what happens in the private sector as opposed to the public sector, and we're dealing with primarily the absenteeism within the public sector, because that's an area that we have some control over. The fact that there is a 70% increase between public sector and private sector. Has there ever been any study as to why, or have we created a culture within our public sector which encourages the bullying and the other aspects? Because we're aware of people who, for one reason or another, put themselves forward as a whistleblower. There's a case yesterday associated with this, where somebody goes forward as a whistleblower, and as a consequence of putting their head above the parapet, they end up being targeted and subsequently having to stay off work until such, the extended leave periods, and that being a very big problem, and probably within one of the major employers in thinking of health, particularly probably one of the key areas where that seems to go on endemic. But I'm wondering, has there ever been any work done on that aspect?
There has been work done. This has been looked at nationally, and I'm sure internationally as well. One of the factors is that public sector employees, the workforce tends to be a bit older than the private sector, and of course with older you get more chronic conditions and you get more absence. It is very variable according to across whether the gender differences and the age differences are important as well, and that also the balance of whether it's long-term sick or short-term sick. I think one of the things that I mentioned was an important building block for any employer is having in place the policies to address the very issues you're raising there, which are harassment, bullying, stress related to conditions in the workplace. And it's important that policies are not just in place but are supported and implemented by staff. And I think training for managers and line managers and senior managers about the importance of this in terms of the overall impact on the motivation, productivity, efficiency in the workplace is very important.
Michaela?
Yeah, thank you, Chair, and thank you for your presentation. I'd just like to congratulate John on the birth of his baby son and commend him for raising childcare issues. I know that the
He's an
report...
expert on childbirth as well, you know.
At least he got to the hospital this time.
I know the report has a particular focus on cycling and walking to work, but speaking from someone who represents a rural area and speaking to a number of disability organisations, I do know that one of the barriers to work with people who have disabilities, particularly mobility disabilities. Was there a piece of work or an evaluation done around what more public transport can do to assist with this? And was there a conversation between the employers and the public sector in terms of transport? Obviously, I know it has improved, maybe in the city areas, but not particularly in the rural areas. And is there any differences north and south in terms of the public transport? Is it better in the south or is it better in the north?
I'll come to Teresa probably to answer this in the main. I think it is a very important issue in a region like Northern Ireland, which has a high proportion of rural areas and where transport is a particular difficulty. And often the infrastructure doesn't lend itself to walking or cycling, even if the distances are appropriate for it. And I think that does mean that public transport has a key role to play. And particularly integrating public transport, there's talk of a public transport hub in Belfast, which I think would be a major step forward, particularly if it does build in initiatives like cycling facilities, safe, secure cycling facilities, and also if we do get to the stage where we have, as I understand, Belfast City Council are planning to have something like the Dublin Bike scheme. So I think those will all help where people are travelling in from rural areas to a hub, but then are actually able to avail of walking or cycling to actually get to their workplace. Just experience in the south?
Yeah, I would echo what Elizabeth said in terms of it is obviously a very important issue. I'm not aware of any particular differences in terms of access for disabled people in public transport being particularly better in the south than in the north. I suppose one thing I would comment on, though, is that while obviously these approaches are important, we need to recognise the issue of rural locations, and I think that's reflected even if you look at the mode of transport to work in the Northern Ireland Travel Survey. It's significantly lower in east and west compared to Belfast in terms of walking, cycling, bus or car, and a bus or train, and the car is predominant. But I think the flip side of that is you look even in areas where there are good public transport, even in areas where people do have short journeys to work, there's still a significant reliance on the car as the form of transport. So I think even to work on that cohort of people that are amenable to change would have a significant impact in terms of overall workplace health.
Maybe just bring Joanna in as well on that point.
Just to add one further point, actually, in relation to the commute to school, which I think is an important dimension because of the number of parents and children involved in that. Sustrans is currently running an active schools travel programme, and they are, over a 3-year period, they are involving 180 schools in their active travel to school programme, where children are encouraged to cycle, scoot or walk to school. But it also includes, for those who are located a little further away from the school, park and stride, so parking a little bit further away from the school rather than involving all that congestion and the safety issues of parking at the school gate. So the park and stride, or park and cycle, so park further away but cycle the last leg of the journey, if you like. So there is some good work going on that is encompassing rural areas where we understand obviously there are greater challenges in relation to the public transport, but just that in itself is helping to bring about a cultural change in terms of how we view travel and our daily commutes.
Good to know. Thank you.
Mitchell?
Yep, you're very welcome. I'm just regretting I should have met you about 30 years ago in my personal case. I think the argument, I get the arguments and I get the principles and the benefits of it as it's laid out, and these kind of workplace initiatives. I think the evidence will demonstrate that there's a clear benefit. So, I'm coming at it on the basis that I understand that and I support it. In fact, I support it strongly. And we've local initiatives in this building, like when the lifts go out, they don't repair them, The one I'm thinking about goes down to the basement where the canteen is, so you could see that there was a very subtle ploy. But the issue of unemployment, I think, or not unemployment, sorry, long-term sickness is an issue within the public service. We are higher than comparable kind of workplace experience. Particularly in Britain itself, and with the South, and that may have some relationship with the with the conflict and being in a post-conflict society. It's bound to have some connection, even though the science doesn't really kind of help us much in determining that. And that may be the explanation why we are higher even in the context of similar occupations and workplace experience. But the programme that you've described seems primarily to be aimed at the active workforce. I just wonder if we have considered delivering this support to staff who are out on long-term sickness, and perhaps if it has been done, and whether that actually demonstrates some benefits in terms of earlier return to work.
Yes, yeah. There is the responsibility in terms of people who are off long-term on sick or disability rests with DEL, the Department for Education and Learning, but they have had a programme in place for a number of years, condition management programme, which works with the health service to support people who are out of work and bring them back to work, and that covers a range of physical and mental health conditions, but probably well over 50% of it does relate to mental health issues, or mental health combined with a physical health problem. And there have been a number of pilots both within the civil service, and I think probably Dr. Ken Adley, who I believe will be coming to speak to when we present evidence, will probably be able to tell you more about the evaluation of that for civil servants and bringing them back to work through the condition management programme. Health trusts have also been piloting it, and it certainly has shown very promising signs of bringing people back to work, supporting them back to work. Anecdotally, a lot of people saying they wouldn't have been able to come back to work if they hadn't had the support of the
And are your remarks in the context of this region, or
Yes, they're from Northern Ireland. Yes, yeah. I think 2 or 3 of the trusts have been piloting it. And I think where we find out things like that work, I think it's important that we try then and mainstream them and roll them out and demonstrate to others that they work, so that they will introduce them. Because I think getting in earlier, before people have actually gone off on long-term sick, is one of the key things about this. The earlier you can get in and support people, the more you'll be doing to prevent.
No, I can see that.
Absence.
And the fact that this has now been brought forward maybe might mean that we're actually just possibly still a bit early in the curve, in the learning curve, to be able to properly quantify it. But I have no doubts whatsoever that it will be beneficial. But this is nearly like applied science for people who have become sick, or either through stress or some physical disability has emerged over the period of their work
Yes.
experience. And I mean, we have, I think, quite close monitoring of sickness levels, and there has been, I think, fairly genuine efforts across the piece to reduce those statistics. And I think at the short-term kind of sickness level, there may have been measurable impacts, but long-term, and that seems to be the explanation that's offered for the stubbornness just of the high incidence of absence that we have. So you're indicating that there is in fact some...
There are some promising programmes, and I think...
pilot programmes, and
they're
is there
pilots,
evaluations done?
and there have been evaluations been done. It's based on work elsewhere, so I think there's experience from elsewhere that's been brought into Northern Ireland and used here. But I think, you know, if you look at the evidence of if people are off for 6 months, the chance of them getting back to work is quite low, and if they're off for a year, then I think the chances of them getting back to work are negligible. So I think it's important early intervention, and I think you're right, a lot has been done in terms of managing sickness absence. I think what we need to do is to complement that with programmes to improve health and well-being and to help intervene where people actually have a long-term condition and are needing support. So if we had a sort of a three-pronged approach, I think that would help to drive down the overall levels
I
of
have to say I wasn't expecting to hear that, but does your work indicate that if people are out on long-term sickness for a year, they're very unlikely to come back?
Yeah. Everybody.
Okay, thank you. I presume we're going to hear in the course of this at some stage just outcomes of those evaluations, because I do think that there would be beneficial impacts of actually delivering these supports to staff who are already out on sickness and whatever stress kind of reasons, you know.
Yeah, and I have a contact in the health service if it would be useful, if you would like to follow that up
Thank you.
in terms of
Thank you
the
very much.
practical experience of delivering it.
Just following on from that as well, I mean, obviously the committee's looking at the area of flexible working at the moment, and I think we found there's there a bit of resistance certainly in some of the comments that been made from senior members of the department. Do you have a particular view of flexible working and how it affects sickness levels within the civil service, and what the benefits of it would be in terms of a fuller rollout of options in regard to
I
that?
don't have any hard figures, so it's more of I suppose you could say it's more of a gut feeling that, particularly when we come to issues of disability, I think if people can be permitted to work partly in their own home, distance working, and I think often the work in the civil service may lend itself to that, where it's working on with a laptop provision or whatever, and with modern communication technology, I think that can be supported, then I think that would be beneficial. And I suppose it's about having the mindset to recognise where those opportunities are available, and I think the experience is that staff, you know, appreciate that and don't abuse it.
Yeah.
So I think probably there's some concerns that people, if they're not under somebody's eagle eye, that they're not cracking on at the job. I don't think experience bears that out.
Is it?
And certainly our own organisation is quite supportive in the institute in terms of home working and being flexible about that. So we're practicing what we preach.
Good. Is it?
Could I ask you three sort of different questions? First of all, has any work been done in analysing the problems of people who are on the benefit system, and when in fact the incidence of mental health kicks in, caused by stress of the whole process?
Stress of dealing with the benefit system? Or?
Particularly the tribunal system, yeah.
Yeah. I'm sure there is, but I don't have that to hand at the moment.
Be interested to see that if such a thing exists.
Okay, we'll look into that. We can certainly come back to the committee with information on that.
Thank you for that. The other, perhaps a little more lighthearted. Has any work been done on the substances that are added to food and the proliferation of them, many of them working against each other, salts and sugars and all the other enhancers and preservatives? You know, the whole thing has got to be, if anyone takes the time to read a label or on a packet or a tin. It's incredible what's added in there. What is the cumulative effect of all those things on health? And the last point, well, maybe some of them are embalming fluids, I don't know. But for the ordinary person in the public, you yourself mentioned, Dr. Mitchell, there about fats. The ordinary person hears that fats are bad for you, saturated fats are bad for you. Recently we heard, no, that's not the case at all. They're actually good for you. Sugar's a bad one now. But you can take that whole line back and you'll find all this contradictory butters and margarines and butters. Soya, for example, a known component, I suppose, and the wrong side of fighting against cancer. And yet they're all in there. Are you doing anything about that to get?
I'd love to be able to solve that one. I think one of the issues about food and nutrition is this contradictory evidence, and I think people do get confused about it. But I think one of the basic principles is that the less fewer additives and preservatives and things that have been added to the food. So I think if we can get back to locally produced food and prepared in the home, that's bound to improve the overall standards of nutrition and levels of obesity.
But is that not a bit naive now in today's modern fast life?
Well, I think the corollary of it is if we don't do something about this, then the levels of obesity, levels of diabetes are going to overwhelm our society. So, I think it beholds us to try and do something about it. And there's a lot of advice on food and nutrition, and if you follow the basics, I think you won't go far wrong. John McAllister mentioned vending machines, and I think there are important issues like that in terms of sugary drinks and all those others. I'm going to bring Joanna in because she actually did her PhD on some issues very related to this, so she'll be able to update you on this.
Thank you, Liz. I did some work looking at reducing the salt content of processed ready meals, and they're one of the biggest food categories in which there's a high salt content because of the amount of processing and reduction in flavour, and that's compensated for by salt, which is cheap and readily available. And what's interesting, my study revealed that we were able to reduce the salt content of a cottage pie, which is a very standard meal, homemade meal, but also a very common ready meal in the market. We were able to reduce that by 30% before consumers actually noticed the difference in taste. There's no difference in the sensory quality of the product, i.e. the taste, the flavour, any of the other attributes that you would experience as you're actually eating it. And the technology is well advanced in terms of food systems now to compensate for any reduction in salt in relation to preservation. We don't need salt as a preserving agent any longer. Technology has well surpassed that. So certainly there is the scope to reduce, and under a number of government schemes there has been a commitment by retailers and manufacturers to reduce the salt, fat and sugar content of foods. And I would endorse Liz's point about going back to cooking from scratch where we can, and I think that will come through in terms of the sourcing food locally in the procurement guidelines, and that's what we need to be doing to ensure we're sourcing food that's grown and produced in Northern Ireland, and that we're cooking from scratch. And that in itself is both skilling up people, and as well as that, it has obviously the nutritional and the health benefits, but it has benefits to the economy as well, where we're actually putting money back into our own economy here by closing that loop in terms of the food production cycle as well. So there are many benefits. And in relation, if I could just maybe pick up on the point about the vending, I had a couple of thoughts on that. To look to the Food and Schools work, I think it's a very good example of how they have tackled vending, and there's some very good and pragmatic information available there within the Food and Schools policy and all the supporting documentation around replacing the high sugar and high fat foods that populate many of the vending machines. And I share your concerns about just the impact of those on diet and how easily and readily available they are. There are obviously many counter-arguments about the economic benefits that those bring to organisations as well. That has to be weighed up in the context of what is the long-term economic impact in terms of what's picked up by the health service from the negative health effects. Some funding has also been awarded in Belfast for Belfast to be established as a sustainable food city. Am I correct? Is that the correct title is? And part of that particular project involves looking at healthy vending. So there will be some work taking place in the next year, and certainly rolled out. I think it's a 3-year programme rolled out over the next 3 years that will encompass healthy vending. I think it's an area that we do need to look at, and particularly in leisure facilities as well, so that we're not counteracting those health messages of physical activity by stocking vending machines with very unhealthy, high-fat, high-sugar foods.
I didn't ask anything about vending machines.
But I just wanted to pick up on an earlier point.
We've covered that point. My point was to do with the contradiction in what's good for you and the changed circumstances that are continually appearing. For example, I would value your opinion on the latest one, which is wheat is bad for you, breads are bad for you.
Yes.
What have you to say about that?
I think what we have to go back to is there is a lot of evidence produced on a daily basis, and it is contradictory, but we need to be very rigorous in how we actually examine some of those studies. And some of those are not necessarily primary research studies, but are a meta-analysis or a systematic review of existing work. So one needs to look very carefully at the nature of the studies that are actually being published. And what's also important, the media sensationalise. They pick up headlines and they sensationalise particular facts, which then presents conflicting messages to consumers. So what I would recommend is that we go back to Department of Health and Food Standards Agency guidelines on healthy eating, and those are being analysed by senior scientific officers who have a high level of expertise in these areas, and they're representing government perspective, and what's published in relation to those is what we would recommend that everyone here and that consumers adhere to.
Well, it does trail behind, quite a bit behind, news coming up. Can I ask you one last bit? The 5 a Day campaign, I'm sure you know about that, how that's been promoted as a healthy thing. Did you realise that was initiated by the fruit growers in California to sell more fruit? That was a fact.
I think no doubt that they are very supportive of it, but I think there's also evidence of increasing health benefits from having 5 portions a day of fruit or vegetables in the diet, and anything you can do to increase fibre is beneficial to health, not just including bowel cancer as well. So there are numerous health benefits from increasing fruit and vegetable consumption, and in Northern Ireland it's something again that we're particularly low in terms of our uptake in, I'm afraid. So and particular challenges perhaps in getting children to take the recommended levels.
How low are we comparatively?
3.5 a day.
I think you're jesting, but I think it probably is. But most people manage to scrape by in sort of a couple of portions.
Yeah, it's probably half the recommended.
It's about half the recommended levels.
How does that compare with Britain or the South? Or?
We are lower, and again, I can send you exact statistics on this. Don't know whether you've got the figures for.
I don't. I would. They would be quite similar. Marginally better with school children, and again, there's a drop off in the teenage years in terms of fruit and veg consumption.
Okay, Deputy Chair.
Thanks. Morning, till this morning. Yeah. Just looking at the BBC website here, and they are announcing that they're announcing the launch of a new website to highlight warning signs of mental health problems in children. And they say that 850,000 children in the UK have a diagnosed mental health condition, and that 75% don't receive the help that they need. When it comes to trying to deal with illnesses and causes of absenteeism in the workforce. Is it, by and large, too late then? Because many of the causes of these have become ingrained from an early age, so therefore the focus should be on early intervention and early prevention, and then we would have less to do when it comes to the workplace.
Yeah, I think you're absolutely right that the seeds of many adult mental health problems are sown in childhood, and the more that we can do to support children and adolescents with developing resilience, mental resilience, the more we will do to lessen the impact of this in adult life. We've got the situation, of course, where we have to deal with where we are, and we can't ignore those people already in the workforce and suffering mental health problems. But there is, again...
The same applies to, unhealthy eating and
yes,
other factors.
And so very positive signs are that we have this new food in schools policy, which looks at the whole educational side as well as at what food that's actually served in schools. And we also have the pupils' emotional... It's PEHAW, Pupils' Emotional Health and Wellbeing policy, which again is a joint policy between education and health, which aims to address those very issues in school children of promoting positive mental health, putting in place services for children who already have mental health concerns, and signposting them to counselling services and other things. So there is work ongoing on that. As always, more can be done, I've no doubt. And having good policies isn't enough. They need to be implemented and evaluated.
I just wanted to ask you about workplace events. I know that they're held in many workplaces to emphasise various measures that can be taken to sort of combat, for example, stress, healthy eating, blood pressure and so on. We had a very good one here. I think it was Food Safety Ireland that promoted it with MLS here. It was over about 8 weeks, and several of us took part in it, and we benefited from it. But the problem with those things is that when the programme ceases, people are liable to lapse into whatever habits they had before that. Is it possible to extend the benefits of workplace events further, so that you avoid the lapse back into, as I said, previous habits?
Yes, I think there is, and there's a good example where I was working previously in the Department of Health. They've had a workplace health and improvement programme in place for a number of years, and I think it started very much with the kind of events that you're talking about, where they would have a health fair and people might go and get their blood pressure checked and other experience other screening techniques and so on. But over the years we've developed it. We have a range of things in place. We offer smoking cessation programmes, we offer weight management programmes, we have walking competitions, things to promote physical activity, sampler 8-week programmes, for example, for yoga or Pilates in the workplace at lunchtime, and the employer allows people to go at lunchtime to participate in that, and to encourage people into trying new ways of getting physically active. And also then running healthy eating weeks and promoting information on healthy eating. So I think there can be a range of things that can be done in the workplace. I think you need commitment of senior management to support that. I think you need involvement of the staff in developing the programme so that it's meeting their concerns. And I think if employers say consider this as part of their managing sickness absence and get in behind it, then we'll get good results from it.
Paul mentioned the private sector and what can be learned from them. I believe that in some cases the bigger companies employ private health screening firms, and they have regular screening of employees for various illnesses from blood pressure and heart performance and so on. Is that something which we could do more of?
I think if you look again at perhaps at the Northern Ireland Civil Service, the Occupational Health Service provides a programme where they will assess people's levels of fitness and screen them on that, and they'll repeat that on a regular basis so people can see whether they're improving or getting worse. So I think there are mechanisms of doing that in-house. That doesn't necessarily mean that you have to go perhaps to a private provider to get it. But one of the report that I mentioned earlier, which has recently reviewed the evidence, was the City of London, the Corporation of the City of London, and they looked at all of the sort of the big banking sector, financial sector employers and what they were doing in terms of best practice and what worked for them. And yes, many of them would have avail of the kind of services you're talking about.
So you are learning from
I think,
what happens
yes,
in other sectors?
you can certainly learn from good practice, but I think the messages that are coming through are very similar in terms of its multi-component programmes that deal with physical activity, nutrition, smoking cessation and mental health and well-being, and that it's supported by senior management, that it's got engagement of the staff in designing the programme, and those are the elements of success. And then the condition management, where you actually identify people with disabilities or illness and support them to either try and keep them in work or get them back to work early.
Thank you. Thanks, Chair.
Thanks, Deputy Chair. Something the committee is always referring back to is the issue of preventative spending. So we invest now to save 5, 6, 7 years down the line and realise the saving in terms of the public purse. Do you see your work very much being involved in promoting preventative spending? And also, we've also looked at the area of wellbeing, and I know that the Minister is looking at this at the moment as well, and the fact that some departments see themselves as silos. So a lot of people think you're an organisation about health, you belong with the Department of Health. It's nothing to do with DRD, DOE in terms of planning, etc. So in terms of that, is there still a degree of work to do, or are departments begin to realise, whether it's the Department of Agriculture to do with food, Department of Environment to do with planning, and I suppose DRD in particular in regard to transport, do they have health responsibilities as much as the Department of Health?
Yes, I think I could answer that from two perspectives. One, the Department of Health is developing a new public health strategic framework, which hopefully will be published in the near future, and all departments have been involved in the development of that and agreeing to outcomes that they can contribute to improving health outcomes and wellbeing for the future. I think the other aspect is, if we look across departments as employers, they have a good framework in place for this preventative aspect. I think it's about making sure that all senior managers across departments give emphasis to implementing it effectively. And I think there are good models there for them to follow. And it's a question of actually putting a small amount of resource, I think, into actually making these programmes effective and put them in place across all departments.
Okay, members, have enough? Okay, Elizabeth, Joanna, Teresa, thank you all very much.
Thank you very much.
Change the colour of vegetables from green.
Okay, members, paragraph 21 of the IPH paper refers to procurement guidance note in relation to food and catering services. Can I seek agreement to obtain an update on this from the Department, including in terms of its implementation?
Great.
I can seek agreement that the briefing paper from today's session is covered to the Department in advance of the evidence session on health and wellbeing measures next week.
Agreed.
Moving on to the next session, briefing by research in regard to defamation in Scotland and the South. I refer members to the Assembly research paper, pages 11 to 48 of your packs. And can I welcome Michael Potter to the committee. Michael, you want to give us a brief overview of the paper before we go to questions?
Thank you, Chair. This paper supplements a paper on the Defamation Act presented at this committee in June of last year. The paper gives a brief overview of defamation in Scotland and the Republic of Ireland, as requested by the committee. The paper constitutes research material only and should not be taken as legal advice or legal interpretation. So just to recap, the Defamation Bill was introduced at Westminster in May 2012 and received royal assent in April 2013. It came into force in January 2014, so just this year. The legislation was not intended to codify defamation law into a single statute, but to make certain substantive changes to defamation law in England and Wales only. Just in general overview, in broad terms, the basis of defamation law in Scotland and the Republic of Ireland, as in England and Wales and here in Northern Ireland, is in common law. A certain degree of codification of defamation law was introduced across the UK, including Scotland, in the 1950s, and a similar exercise undertaken in the Republic of Ireland in 1961. Further codification of UK law was undertaken in 1996, although the reform of defamation law was being discussed in the Republic of Ireland from 1989, it was 2 decades before further codification took place there. So, Scotland. While Scotland was included in the 1952 and 1996 Defamation Acts, devolution provided an opportunity to remain outside the provisions of the 2013 Act. The Scottish Government chose to opt in to Sections 6 and 7 of the 2013 Act in order to ensure parity of protection in relation to academic publications and conferences. However, Scotland opted out of the rest of the Act on the following grounds. Scots law was considered sufficient to deal with defamation issues, and the same issues that gave rise to the Defamation Act in England and Wales had not arisen in Scotland. Those are the views of the Scottish Government at the time. However, the Justice Committee of the Scottish Parliament recommended that the Scottish Law Commission be asked to consider that Scottish law on defamation should be reviewed. I haven't seen any further development in the respect. Certainly the current programme goes to the end of 2014, so it remains to be seen whether it will come onto the next programme for the next few years. In the Republic of Ireland, after a long development period, a defamation bill was introduced in the Seanad in 2006. The main purpose of this was to do the following: introduce more modern updated provisions to replace those of the 1961 Act, take into account developments in jurisprudence since the last codification in 1961, and to take into account the European Convention on Human Rights. The bill was passed as the Defamation Act 2009. Just some broad information around the main debates that have been going to and fro in both of those jurisdictions. There have been debates about reform in both jurisdictions, the most significant perhaps that of whether to legislate or to allow common law to deal with defamation. In the Republic of Ireland, it was decided to codify to a certain extent, whereas in Scotland, further codification has been largely rejected. The issue of libel tourism, as dominated debates in England and Wales, does not appear to have been a concern in Scotland. Similarly, I could find no references to libel tourism in the debates in the Oireachtas during the passage of the Defamation Bill there. So, Appendix 1 of the paper summarises the main provisions of the Defamation Act 2013 in comparison of where these issues are featured in Scottish and Irish legislation. It doesn't infer any legal equivalence, but merely indicative of where these issues appear in the legislation in the other 2 jurisdictions, or more significantly, where they don't appear in the different jurisdictions. So that's my brief summary of the paper, Chair.
Thank you. I wonder, could you elaborate slightly on the issue of defamation of deceased persons. They were saying, there was mentioned in the report about Scotland, and there was divided views in terms of consultation in regards to that. Could you elaborate on that aspect as well?
Yeah, that was quite interesting that it came up in both Scotland and the Republic of Ireland, but doesn't seem to have been a feature much in the debates in England and Wales around the Defamation Act there. It was suggested in the passage of the Irish legislation, but didn't actually come out in the Act in the end. And there was a consultation by the Scottish Government on introducing something around defamation of the dead. But again, there's been no further from that since the consultation closed in 2011. And responses to the consultation were divided, really.
And do we know, I mean, in Europe and the United States, is there
that's a good
any
question. I
difference?
haven't looked into that, Chair, really.
Curious, I mean, from the papers, there's a very useful paper on it, but one of the key, I suppose, debating points on that, which I think links in with the libel tourism issue, is, I suppose, the requirement on the serious harm situation, because I suppose the argument that has been used in terms of the libel tourism is that if you move from the current position, or sorry, I suppose the argument essentially is if we fail to move from the current position in which libel is actionable per se to a situation which now pertains in England that you have to show serious harm before libel can be shown, that if we fail to move, that there would be sort of a flood of libel tourism. But I think if I picked up right from the paper, essentially both Scotland and the Republic have retained more or less the actionable per se. They haven't moved towards a serious harm threshold. Would that be correct?
No, certainly not in Scotland. My memory of the Irish one is that they
When it says about the according to your paper on that, on page 18 of, well, the fact that 6.5, the tort of defamation is actionable without proof of special damage. So consequently, that would suggest that it is sort of actionable per se.
Yeah, in the comparative table of Appendix 1, again, without inferring legal equivalence, the 2013 Act, when it talks about serious harm, there is the Section 12 of the Irish legislation does refer to that to a certain extent, but it doesn't exist in Scottish legislation as yet. Yeah. Just in common law.
Right, okay, thank you.
Okay, any other members? No? I wonder, Michael, could you follow up on that piece about defamation of deceased? I would be interested to know any other examples, or in terms of other jurisdictions, might be an issue that arises in the future.
Chair, I mean, on that basis, I mean, it has been obviously the situation in, I suppose, British law and Irish law in that regard, that you can't defame the dead, and it's been a sort of a general tenet of libel. And we'd be interested in share with the chairs, but I mean, it would be interesting to see if there are any jurisdictions that there is any. I mean, it might be that there isn't, but is any jurisdictions where there has been any provision for defamation of the dead?
Yeah, it was suggested in the debate in the Shawnet that one of the senators there suggested a compromise whereby you can't defame the dead for a year after their death, but it didn't it didn't appear after.
Yes, they can agree, aren't you? Not far enough away.
It's about offending the family, that kind of thing.
Yeah.
Mm-hmm.
Okay, Michael.
Okay.
Thank you very much.
Thanks.
Okay, members, moving on to the next evidence session from Mike Gilson from the Belfast Telegraph.
Chair, can just clarify just one small point just in relation to the next evidence session. That I see just in terms of the table papers on that, it talks about that item. I know it provides, which is useful enough then, a couple of articles then by Paul Tweed. I'm just wondering, there wasn't anything. No, I understand that. The point I'm making is that Paul Tweed, I'm assuming that Paul Tweed's view would be quite different to Mike Gilson's. I'm just wondering if there is anything written sort of from Michael. It's just an oral. It was marginally confusing whenever you look up the table papers under Mike Gilson and you see something from the opposite perspective being sort of being tabled in that regard. I don't know if we need to fire the sub-editors or whatever.
Just for further information, Paul Tweed sent both these through just for the meeting.
No, I understand that. It was just maybe the fact it was the way they were labelled when I think it was given a slightly wrong impression in that regard.
I think I could confirm that myself and Mr. Tweed would differ quite a lot on this issue.
Thank you, very welcome. Do you want to give us a brief overview of your position
Yes.
in regard to its
Thank you,
proposals
Chairman,
today?
and members of the committee. First of all, thank you very much for giving me the opportunity to speak to you today on what I believe is a very important issue. As you know, my name is Mike Gilson, and for the last 4.5 years I've been editor of the Belfast Telegraph. I'm responsible for... Excuse me, do you mind if I just... I'm responsible for all content at the Telegraph, the newspaper, the website, and all our various digital applications. Before Belfast, I've been an editor at a number of titles across the UK. Indeed, I have edited titles in all 4 countries of the UK, the last one being the Scotsman. So I have a fairly unique insight into the publishing environments of the jurisdictions of the nation. And I'll start, if you don't mind, with a personal appraisal which is based on my experience as an editor. And that is, and it is just a personal opinion, and that is, we are quicker to take legal action here. We are quicker to threaten with lawyers and to hand out higher levels of damages when it comes to defamation than anywhere else in the UK, in my experience. It is a clunky process, it is drawn out, and it is costly. And by that, I don't mean the libel tourism that we've talked about previously, of rich people going to London from around the world as they did before the Defamation Act 2013 effectively put a stop to it. I mean a lower-level culture of lawyers chasing payouts for clients that should rightly, if errors have occurred, be settled with simple corrections. The cost in time and money of this culture is both a chilling effect on journalism and sometimes leads to payouts, where a perfectly good defence could have been mounted if a newspaper or a publisher had the resource to mount it. And that is why we all welcome the Defamation Act of 2013 as it applied to England and Wales. And it wasn't just for us, I have to say. It was for defendants, whether they be newspapers, academics, back-bedroom bloggers, but also for claimants. Because I think one of the things that is very clear, that the Defamation Act of 2013 laid out as never before clear law on what constitutes defamation, replacing myriad interpretations of common law threads stretching back well into the Victorian era. So not only are publishers in England and Wales much clearer of the lines of battle, but claimants have a clear-eyed view of the threshold they must cross to be successful, rather than gamble on ever-escalating legal costs to possibly win a case. I should remind you that the current state of laws in Northern Ireland are so open to exploitation that President Obama was forced to legislate to protect American interests from foreign rulings that impinge on freedom of expression. So chilling had London's reputation as the libel tourism capital of the world become. In my opinion, now only Belfast stands to gain from this dubious industry. And this is not a case of vested interests, somehow protecting the rights to slander and libel the little man with impunity, as some Belfast lawyers have so colourfully but misleadingly portrayed it. It is about supporting a law that goes to some way to underpinning something that is vital in our society, and dare I say even more so in ours, which is freedom of expression. So what is it that we're so worried about in this Defamation Act that so inexplicably and undemocratically disappeared from the executive's radar? Should we be worried by a law that says a claimant has to prove serious harm to a reputation rather than simply assert it? That a rich company has, or is very likely to suffer, serious financial loss and has to prove that under this law? That a simple, clear threshold that might stop frivolous claims and dispose of them at an earlier stage before much time and money is spent is put in place? Surely not. Could we object to a law that says a publisher has to establish that the piece in question is true to claim a defeat? I don't think so. Should we be concerned with a law that widens protection of freedom of expression and comment by allowing a defence of honest opinion for an article based on facts understood at the time, and that asks the claimant to prove that a defendant did not hold that opinion, as opposed to the present fair common defence, which I can tell you from personal experience is almost impossible defence to argue? Again, we shouldn't be worried about that, in my opinion. Is anyone really worried about a clause that allows defendants to argue that a statement complained of was on a matter of public interest, or that there was a reasonable belief that this was so? Public interest is put right at the centre of this legislation, and I can't think of a single objection to that. And given that Northern Ireland is like the rest of the world in the 21st century, what is wrong with a law that covers the explosion of digital publications and gives them hosting defences? I can't think of one, and I'm sure Google and Yahoo in the South would also agree. And how about a law that gives protection for reports in any proceedings under any law in any country in the world, other than that we have now in just the UK and the EU? Publishers will have to have a twin-track view here. What is accepted in London and Cardiff might not be here. And what about protection being extended to cover press conferences, scientific and academic conferences around the world, as well as statutory meetings like this in the UK? Is there anything wrong with that? And a proper limitations, a statute of limitations for websites, rather than someone finding something on an archive and suing again and again and again. They happen to find it on a search. And in a country where Queen's and Ulster universities try to attract the best scientists and academics, what is wrong with giving protection to peer review statements in publications so that robust opinions can be expressed on vital research work? Dr. Simon Singh would still have had to spend possibly £500,000 in this country, as he had to in London, to fight off a claim from chiropractors against his dismissal of their claims they had an effective cure for colic and other childhood diseases. Would Dr. Simon Singh take up a post at Queen's? And what, as Mike Nesbitt has pointed out in his consultation, is wrong with giving a judge the power to decide whether a case is appropriate here if the offending article was read 10 times here, but maybe 100,000 times in New York? Surely no one, except for lawyers in Belfast who might in years to come make a nice little earner from it. I make this point to argue really not about comparisons with with Republic and Scotland, but to suggest there is absolutely nothing sinister about the Defamation Act 2013 as now adopted in England and Wales. It puts freedom of expression on a firm footing, but it does not stop people getting financial recompense for serious and malicious falsehoods and defamation. In Belfast, we risk having the most punitive defamation laws, and it's not something we should be proud of. Northern Ireland has, as we all know, a almost unique system of government that needs scrutiny, perhaps more than most, and from committees like yours do an excellent job. So should a free press, and by free press I mean bloggers and websites and tweeters. Look at the story of this case itself. Without the probing of journalists, we would never have known that this had kicked into the long grass, I don't think. Why? Who was behind the decision? We hear that Sammy Wilson appeared to have recommended at least some adoption of the Act, but it became lost in a black hole somewhere. Why? Was it anti-press? An attempt to keep us under the thumb? Did lawyers have the ears of prominent politicians? Was self-interest at play? Journalists should be fearless in probing and reporting on stories like that swirl around, for this is clearly in the public interest. And I would argue this work needs to go on without the chilling effect of an outdated collection of old common laws that are simply no longer fit for purpose. We need something that strengthens public interest, requires proof of harm, financial loss, legislates for the web, and does stop the potential for libel tourism. And this Act is the best we've got. I would just ask that why should the people of Northern Ireland not have the same protection of those in England and Wales?
Thank you very much, Mike. It's an interesting one, this, and I know there's some who have different views and some who have viewed changes according to the evidence that they're hearing. But I suppose that there is that point that the media should be able to act in the public interest without fear of being bullied or cajoled. But there's also the issue of the protection of the individual, of the family in some circumstances where, you know, there's responsible media and then there's irresponsible media, and if an individual is subject to a certain story, it could destroy their lives. So there's a need for that protection to be there too. So do you think that we should adopt the Westminster legislation wholesale? Should we have a selective approach, as in Scotland, with a different choice, or should we go further in some regards to suit our local needs?
Well, first of all, I think dealing with Scotland has been a separate legal entity since 1707. So really, you know, you might as well compare us with Nova Scotia, California. I mean, in that sense, it is different, although they have adopted the scientific element of it. When I look through the Defamation Act, I really can't find that much that couldn't apply here and wouldn't be a reasonable and sensible adoption. I don't think we need to go further. I see in Mike Nesbitt's consultation that having judge-only rulings was slightly less, and I have to say that was 77% rather than 98% in support of all the things that were in the Defamation Act. But when you look at it, I don't think all it does really is bring together, in what I think is a fairly common-sense way, some very clear rules that you have to do, some easy rules that knock out early vexatious appeals, and bring together some things that are really quite sensible, and they do still protect the person who has been seriously damaged. I don't see anything in that gets anybody off the hook there.
Okay, Peter.
Thank you, Mike. I suppose there's a few points in relation. It's interesting, I suppose, again, as we've seen the research on this. I mean, you said obviously you worked previously editor of The Scotsman, I think, and
Yes.
involved with The Scotsman.
Yes.
One of the most contentious aspects, I suppose, of this, at least one of the concerns that I would have, is the shift in the bar for between basically libel being actionable per se and essentially the situation of having to show serious harm, and the concern of the impact that would have in terms of a lot more libels taking place effectively in that regard. Now, in Scotland, and I wouldn't just take 100% of face value what you've said about Scotland almost being like Nova Scotia, because of I think while there has been a separate legal system, I mean, there's a separate statute book for Northern Ireland, has been since 1921, indeed prior to that, acts of that nature. So it's not just as removed, perhaps, as it's suggested on it. But we're now basically, I think, within a matter of a few weeks, a year, more or less effectively a year off from the implementation of the Defamation Act in 2013. I appreciate that you didn't particularly stress the libel tourism aspect of things on it, but in that year, has there been any evidence of additional caseload or libel tourism emerging here? Because that seems to me a little bit of a red herring, to be perfectly honest on it.
I have to say no, but I think in the life cycle of a law and the way these things move, I think it's far too early to say that. To make I think if you come back in 2 years and look at that, you might possibly.
Presumably, if there was legislation, an amendment could be made to the law. I mean, mention you made also about, the idea of sort of a jurisdictional point. But I'm aware at present the courts will rule that if they feel that there's not sufficient jurisdiction, indeed the one case, I think it was Ewing against the Times that has been heard recently, the court simply ruled that out on the basis that the plaintiff didn't have enough of a jurisdiction to take a case here. So surely there's already a degree of protection within that to prevent essentially sort of people simply using Belfast as a sort of flag of convenience from which to take their case. You have to show that there's a clear, strong sort of link in terms of impact with.
I think that's an interesting case because it's the only one in which a national newspaper was defended in Belfast against a serial litigant who has been declared vexatious everywhere. Frankly, if that case had not been knocked out anywhere, it would have been remarkable. So I don't think you can really use that example.
Well, but with respect, you're not able to give me a single example of any bit of libel tourism.
But as I say, in that particular case you're talking of, virtually everywhere the gentleman has been, he's been ruled out and has been ruled vexatious. It really was a home win, frankly, and it doesn't really prove anything, I would submit.
In terms of, I suppose the other couple of issues on it, I mean, I'd agree with you in terms of the peer review side of things, but there's a way that clearly, for instance, Scotland have taken an approach to, which is to say we regard aspects of the defamation bill as not being particularly appropriate, not needed, maybe sort of things that they're hostile to. But they've said, well, we want to ensure that there is actually protection for academic. Now, same token, I'm not aware of a single academic who's refused to come to Belfast or be based at Queen's because of fear of being sued. But having said that, I think there's a good argument that could have said that if we adopted the Scottish approach and had that direct sort of protection, if you like, for the academic and the scientific journal on it, that could deal with that situation. Similarly, on the basis, I mean, it's probably marginal one way or the other. You're saying about the defence of truth, but there is a defence of justification, which is that which has always been there in common law, which is if you print something and it's true, then it's not libellous and it's a complete defence. So is that? I mean, is that sort of slightly one way or the other dancing on the head of a pin? Whether you rely on common law justification or a very statutory basis of truth, is there any?
I think there is a slight difference, but I think overall what you have here is both for the publisher, and I say whether that be a backbench blogger or me, and the person who is being tempted down a route to look for financial recompense or whatever. What these things set very, very clear, which they don't have now, is that you will be able to say, right, do I meet this test? Can I get to that point before this thing is out earlier? And that doesn't happen at the moment.
But sorry, with respect, justification has been a key defence on libel probably for centuries in that regard. What is the difficulty in actually saying justification is a defence? I mean, where's the uncertainty with that?
Well, I think the
justification is basically truth.
In a sense, you're right. You're absolutely right in that. What I was talking about is the totality here, which is that you have to prove serious harm, you have to prove financial loss. And what I'm saying is that in my experience as editor here in 4.5 years, there is an awful lot of kite flying, shall we say, in terms of what can happen, when it can happen, could we get something here? And the problem here is it does have a chilling effect on journalism, because the temptation is that you don't go any further to defend it, because the costs of going further, and also I would say the awards given by courts here when you eventually get there, and most of the stuff I'm talking about doesn't actually get to court, are very, very high. We have examples here.
Well, with respect, because a case has been proved, because it has been shown both to be libelous and also shown to be untrue, is it not actually quite a reasonable thing that there's actually very high levels of damages being... Surely that should act as some level of deterrent to a newspaper, a blog or a television company, whatever, putting something that's untrue. Surely people need a degree of defence to their reputation, and surely actually something which actually punitively punishes those who've actually gone out and put something that's untrue. Surely that's a good thing.
I don't know whether you should use punitive as a word for settling these cases. I think what you should look at is the person and the damage done to that person's reputation. It shouldn't be used as a punitive measure to say, right, the rest of you, watch out. I think that would be wrong in law. But what I would say is that if you look at
it's a heavy sort of fine, I think is what
I would say is, looking across in my experience in England, Wales, Scotland, is that the level of damages, and let's be honest, we've got examples in this very house, although you people are very lucky to have your libel insurance paid for you, unlike me. But what I would say is that there are certain cases recently, in terms of the former police ombudsman and a former director of Northern Ireland Water, where those damages given were frankly very, very high in my view.
Well, again, if somebody says something that's I mean, I think people take the consequences of it. Just ask two final questions. I mean, from the point of view of the position that you've taken on behalf of the Belfast Group, I mean, the argument is in many ways this would make life easier, clearly, for newspapers, for publishers in that regard. It shifts the boundaries in a range of ways to your benefit. I mean, to what extent could an argument be made that the evidence you're giving is born out of, not talking about personally, but out of a degree of self-interest, if you like, that it's essentially in the interest of newspapers and the media to actually shift the boundaries in terms of defamation to their benefit?
I mean, obviously, I'm a newspaper editor, and I've got an interest in it for that reason. But I think when I look at the Defamation Act, I look at it as a whole, and I look at it as an act that recognises we now live in an entirely different media landscape. I mean, I have 100,000 comments on belfasttelegraph.co.uk every week, and that is a different editing challenge than it was, 10 years ago when it was simply the paper. So we've changed the landscape completely. Things are different. And I think where we are in Northern Ireland is we're not up to date with it, and this Act in its own thing does. So yes, there is a little bit of that. Yes, it does cost money that I don't think that we would have to pay under this law. I think there's absolutely truth to that. But I think at the end of it, we are still bound by truth, as you say, and justification and public interest. We have to argue those cases, and it's right that we do so. We're not looking for a charter just to go out and to hit people over the head. It wouldn't be a sensible option at all.
The final question was maybe something which probably I think everybody would agree with, but it's a question of how we do it, which is obviously one of the major complaints that is made in relation to libel. And I appreciate what you said in the general sense about certain vexatious cases wouldn't be there. I would argue vexatious cases shouldn't really be there in the first place, but by the by. But one of the arguments I think that would be strongly used in terms of the current position on libel, and may still be an argument even across the water as well in connection with that, which is that potentially libel is really quite affordable for somebody who's very well off, but there's a degree of carte blanche to libel people who maybe don't have the financial resources to be able to take the case on it. Either through this legislation or indeed any other suggestions, I mean, how would you see this actually impacting on cost to make it a lot more affordable for people to take libel actions?
I think they're probably two separate issues. I think access to justice is a big issue. Obviously, of conditional fee arrangements that exist in England and Wales, and they don't exist here. But really, I don't think they're really I think it's almost a separate debate.
Well, I mean, with respect on it, if we're looking at a reform of libel law, and one of the biggest problems that is highlighted in libel law is if you're a multimillionaire, you can take the case. If you are Joe Public, realistically, you have no chance of taking a libel action because of the sheer volume of cost. Now, if we're saying well, actually, we're going to have major reforms in the libel law, but by the way, what is possibly the elephant in the room, which is the inability of somebody to take a libel action if they're seen as too small fry in that regard. Well, actually, we'll leave that for another day. We'll treat that as a separate issue. I mean, I'm not sure. I think if we're going to tackle the issue on it, surely we should be looking at all the aspects. And do you have any suggestions of how we could reform things on that aspect to make it easier for somebody who has been libelled to be able to take the case without it being prohibitive in terms of cost?
I mean, I do come back to you and say that I do think that is a separate issue under this. You couldn't do anything under a Defamation Act to talk about finance, legal action, conditional fee arrangements, no win, no fees in a Defamation Act. This is specifically about publishing. I just don't think you could do it in law. It's a separate issue. It's like oranges.
I mean, with respect, there's quite often been interlinked issues that have been put in terms of issues on,
but I don't think
different pieces of legislation. You know, if we're looking at the way that the courts deal with libel law and libel action, why couldn't there be something at least looked at within that same piece of legislation on how to bring the cases and how to deal specifically with that? Because it seems a barrier which is there, which is not necessarily there to the same extent in other forms of law.
Sure. No, I accept your point that you know that it is in some senses a middle rich man's game. This and you know and a probably a company game as well. But I do say I think there are arguments that you could look at in terms of that sort of funding for people who think they've got that. I mean, obviously, I would raise the issue of the PCC if it didn't bring laughs around the chamber. But I think in terms of recourse, in terms of whether those things are a good idea, I think what this Act looks at is how you deal with defamation in the courts, not really how you get there. But I do have sympathy with the fact that most of my letters that I get, I would guess, were from people who, you're right. I mean, it isn't often the small man in the street, because obviously there's no legal aid for defamation.
Okay. Sorry. Yeah. Okay. Thank you.
Okay. I'll just ask as well, Mike. I mean, obviously there's been a bit of debate in the South as well, following Rory O'Neill's comments on the Saturday Night Show, and obviously RTE paid out damages pretty quickly in regard to that case. Is there any sense, through connections with the Southern media and the South in general, that there's going to be changes, or any suggestion of changes in the South as well?
Not that I'm hearing. I have to say again, I'm not really an expert on the law as it exists in the South, but I think here, I mean, it's that there is. There is no question that if you make statements that are wrong, you've clearly got to do something about putting them right. What I would argue, though, is that how can we get a position where we have a strict set of criteria that say this is serious harm? Serious harm is, at the moment, people have to just say, I've been lowered in the mind of a right-thinking man, and you don't. And actually, the burden of proof on that is very, very low, incredibly low. Whereas what we're saying now under this is show us serious harm. And I don't think that's a bad thing. It's not a bad test to actually have. And, we would abide by that. And, we have been, the Belfast Telegraph in my time has paid out for things that, frankly, we look back on it, we think we made a mistake. It's usually a mistake. It's not normally sort of deliberate. But when you do pay out, you do have to just to sit there and take it.
Sure, just to note that, I mean, in terms of putting things out, I appreciate I'm not accusing the Belfast Telegraph, but particularly across the water, there has been obviously the accusation quite often in newspapers is they will have, if you like, the thing which is wrong blazoned across page 1, and then it's a small paragraph on page 15 when a few days later, whenever this retraction takes place. So I mean, there is that issue in terms of times a lack of balance in the way that. But I appreciate I
think it's a fair point. I think it's a fair point. There was some talk, I believe, in the early days of this bill about the judge being able to put where the apology would be, and also in the new IPSO guidelines, should it ever come out. As you know, the Belfast Telegraph is refusing to sign the Royal Charter for this, but if it comes out, there will be much more, a prescriptive view on newspapers about where these apologies go, that they can't go on page 59. It was, page 1 and 4 and 5 at the time. So I think there is an issue there that is a serious one.
But in terms of how you define serious harm, do you think it's important that there be a jury involved in those sort of cases, or is it better left to the judge?
I think in terms of cost and in terms of length, my preference would be for a judge-only decision on that. Someone who knows the law, has got the stuff. But I can see that, and I can understand why that was slightly lower down on Mike's consultation. And I think that would be for debate. It is a very specific, it is a specific area of law, this. And there is a lot of argument to say that expertise and speed, because the longer these things go on, the bigger the costs they are. And I think that's something that really needs to be looked at, because it's costs to the claimant as well as it's cost to us. More often than not, we will look at a case, and it's happened. In fact, it's happened in the last 2 or 3 weeks, where actually we know that we can defend this, but it will cost me far, far too much to even try and defend it. And there are lawyers who know that, and I've just admitted it in public.
Okay, Paul.
Thank you. You did mention about a dubious industry, and I'll use that. That was the term you used in relation to that would be set up in Northern Ireland associated with it if we did not implement this bill. Albeit I believe that there's a necessity for legislation and regulation of social media to ensure that it does meet the same level of scrutiny as the papers have to do, and by that I'm not saying all papers. Some papers set a different level of balance. How do you, and one person's perceived serious damage is totally different to another's perceived serious damage. We've one gentleman who has fought a case over 15 years over what anyone else would sit back and say, it's minor, forget about it, move on. But he fought for 15 years to actually take that through and eventually won it. But in relation to, yes, and there are areas where, from an academic point of view, I think there's a necessity to look at allowing academics, maybe under 6 and 7, to have certain areas where, and I'm not so sure that many of them have had legal libelous issues taken. But honest opinion, to replace the common law defence of fair comment, this is a point. Honest opinion. Some journalists' view of honest opinion is sadly skewed to view their own opinion on many occasions. How are you sure? And I believe that there needs to be proper scrutiny of the industry to ensure that what they do publish is properly backed up. And on the basis of that, it's not a matter of just lifting it because it's been published somewhere else. We can publish it and go ahead. I think we have to give protection to those within our community who maybe cannot and are not in the position to actually serve a major writ and take it right through and take it the whole hog. We have to protect those who are maybe more vulnerable, less able to defend themselves. And in putting forward this type of legislation, it will, in my opinion, and this is my opinion, reduce the level of scrutiny and interrogation that are evidence that's required before you publish something. And it's something that I would like to find your opinion on.
Sure. I mean, obviously I don't agree at all. I think you'd be surprised for me to say that. I think you're right when you talk about social media. I mean, one of the things about the laws that we've got at the moment is they don't take into account that stories are out there already. You know, the genie's out the bottle before you can do anything about it. And, one of the things this defamation law does do is bring social media into the law, which is, again, is common sense in my view, because what it says is that if you host websites, you are not liable, providing that the author of that, the claimant has to go to the author first to see the source of it, so it gives recourse to that person to go after the author who said something online about them. So that's enshrined in law under the England and Wales issue. I think honest opinion really is what makes the world go round, in a sense. It's about honest debate, and it's about the sort of things that you talk about in this chamber. You're followed by obviously absolute privilege in here, and so you should be. But I think actually what newspapers and blogs and things should do for the health of democracy, it should be involved in forming honest opinion. We may not agree with it, we may violently disagree with it, But actually, providing it's within laws, I think it's absolutely a really good defence that this was an opinion I held, it was honestly upheld, it was based on what I thought at the moment were the facts, and I can defend it on that. At the moment, that threshold is far too low for people to sue if I say something about you that you think is just not very pleasant. And I think what this does, we all have...
What protection is there for those and those within that form of media who say, well, look, he's a man of straw, he's not really going to take it very far, and if we have to pay him, we'll pay him minimal damages and we'll publish whatever we want. And that is going on within the industry. And I'm not going to mention names here today, but there are areas where they say, look, we can publish it and say it, let him come back at us.
Well, I don't know of any examples like that. I would say that if there are stories that people want to put, they still have to make sure what's the research on them, what's the facts on them, what have we got on them, what are the allegations we're going to make about them. And sometimes newspapers have to take a stance. I mean, if you look at the Daily Mail with the Stephen Lawrence killers, eventual killers, they were named as killers at the time, and of course there was at the time not a shred of evidence for it. Now that everyone looks at that now as an incredibly strong and powerful front page, and I would totally agree with it. And newspapers get things wrong. We publish about 15,000 words a day. Not all of them are right, I'm ashamed to admit, but there are things that go wrong in the newspapers. Whether people actually go out and say, we can stitch him up because he can't fight back, I doubt that happens. I don't know of anything that happens like that, and I don't know why you would do it. I think if you're talking...
There's cases going through the courts in Northern Ireland as we speak against a publication on that very basis.
Well, obviously then the judge will decide, and we'll see which side of that is true or not. And of course, once again, the newspaper, if it's wrong, will, as it would under the Defamation Act 2013, will pay the price.
They've already made a few payments out on the same issue to the same person.
Yeah, sure, yeah. But I do say that back to my point about the awards, once you get to Northern Ireland, across the experience, we do tend to give out very, very high sums for damages here. Whether it's part of our history, I don't know, but it certainly is higher than it is in England, Wales and Scotland, in my personal opinion.
Well, I think if something has been done wrong on an individual and they feel strongly enough about it, the level of compensation that they receive is not the issue. But I think if they perceive it to have caused them damage and they get good high-level compensation, all part of their wee will.
And I hesitate, just to say again, there is nothing in the Defamation Act 2013 that would stop that. Absolutely nothing whatsoever.
So why do you introduce it then?
Sorry?
Why say?
Because why say what? Sorry.
Why say that there's a higher level of compensation?
Because what it does is it stops vexatious appeals, which there are many, and costly. What it also does is tell the plaintiff and the person who's defending, these are the rules. It's not a whole set of common law things gathered together that are vague and, frankly, the vagaries of different judges and different lawyers. I think that this is, if we put aside libel tourism and all that kind of stuff, which I still think is actually a potential threat to Belfast, and why would President Obama legislate if the Americans didn't think so? What it does do is bring together some very, very good things. Because the other thing that we're forgetting here is there's the right of freedom of expression. And what we don't want, and certainly we don't want it in Northern Ireland, is a chill effect on people on that, because we need it here.
Don't need North
as much
Korea.
As anywhere else.
Sorry? We don't need a North Korea.
It'd be nice if we weren't North Korea. Yeah, I'm not suggesting we are, incidentally.
Okay, Leslie.
I was intrigued by Lord Black's comment on referring to inward investment and the effect of the Defamation Act. He was warning against the commercial dangers, if we operate with a system that's mid-20th century. How realistic are those dangers?
It is very difficult to say, because we're very new into it. I mean, obviously, we up until 2013, England and Wales and Northern Ireland were all covered by the same Defamation Acts. I think it is a potential problem. I think there's no doubt. It's a bit like tax rates. People tend to go, corporation tax rates, for example. People tend to go where they think they can operate in the safest, most.
We know about that.
Yeah, exactly. And I think that for creative industries and things like that, if they have a law that is clear and concise, then there is a potential that they might look, if there's a choice, let's say between England and Northern Ireland, that they could look and say, well, look, the defamation laws here are you know, a bit iffy. The payouts are high, and they are high. The time it takes is enormously cumbersome. So to get involved in that, why would we do it? I think there's a possibility of that, very much so. I don't have any evidence. As I say, it's too early, really, to say that. But I think there's very much a possibility that if you're looking at things, it could be one factor.
Okay, John?
Thanks, Chair. Probably a couple of points. I think earlier, Mike, when you were talking about, you know, or the dangers, and I think Peter asked you about no examples. We'd have to bear in mind it is the 2013 Act, and this is only 2014. You know, we're not a long way into that. I do think the press, particularly here, with our structure of government, have a very important role in providing some of that scrutiny and opposition that we need to see. Probably in the point, I think, Chair, around damages and costs. We've often had this argument even on things like personal injury claims with regard to car insurance that our costs are awarding too high and actually putting up costs on everyone. I would certainly accept Peter's point on the access to justice. I think across the board on justice, there's probably an argument that sometimes access to justice is either for the very wealthy or indeed the very poor. If you can access some form of legal aid, depending on what the issue is. So there has to be you know, issues around that. I accept that it probably wouldn't be appropriate to go into this. I do think encouraging, we're maybe seeing some slight movement on this, that there's probably a broader acceptance that we need to do something. I think, I mean, I agree, and I've been supportive of doing this, of moving. Look, in the 2013 Act did seem to be a very thought-out, measured response to the huge advances in the way people are accessing media and information in the last 10, 15 years. And I think that's why I welcome seeing any movement down that road. I mean, when you're looking and working out this, you'd be prepared to, rather than just do a blanket cut and paste of England and Wales or with slight Northern Ireland modifications, but the broad thrust of that, you think the basis of it is there, and we would do the read across, and we could certainly. The advantage of Mr Nesbitt bringing a private member's bill is that it would have the scrutiny in a committee, in this committee, if it reached that stage.
Yeah, I agree. I wouldn't suggest for a minute that you know, without you know, a devolved government, that we shouldn't take a very, very strong look at it and rather just accept it, you know, lock, stock and barrel. I think the if you look down through it, the starting price for me would be, right, what would you knock off and how much would you knock off it? Personally, I wouldn't. I've knocked very little of it. As you say, it's gone through a very strong process. You know, it's been filtered through Westminster, if you like. It's been looked at by lawyers. And, you know, at the end of it, if what it does is enshrine very clearly to certain people that these are the things that you have to meet. I mean, you know, just to give you some examples, we've paid out. I said we've paid out. We've given money, and we've paid money to fight a doctor who was struck off for severe medical malpractice, suing us. Now, he was struck off for serious malpractice. That didn't stop. You know, that didn't stop him carrying on with a long suit that cost us a lot of money to fight off. Now, we did fight it off then, because clearly it was vexatious. But actually, at the time, you know, I think the new laws would not necessarily stop that, but what it would show, and what lawyers would have to say, is this is the law and one to which we're working. And frankly, you know, rather than take your money, this isn't worth it. There is no serious harm to a doctor who's been struck off for serious malpractice, I would suggest. And similarly,
it's not libelous if it's true.
Sorry?
It's not libelous if it's true. So.
Well, no, I mean, obviously, well, I mean, the thing about true, one thing I would say is inaccuracy isn't always libelous either. I mean, getting things wrong doesn't always make things libelous. We must remember that. Inaccuracy is not defamation. But what I would say is the effort of fighting it is the issue. It's the chill effect that I keep talking about. You know, that this doctor was prepared to go a long way on this. And we thought we had a decent case, and we did fight it. But it cost us, as a newspaper, which I could have invested, frankly, in more reporters up here looking into you guys. It cost me some. It cost me some money.
You're not selling as well.
Have I just missold that? Yeah, I probably have. Yeah.
In that case, did the judge not award cost to follow event?
Sorry?
Did the judge not award cost to
No, what I'm saying is, even before, we successfully, in the end, batted that off before it got to court. But what I'm saying with the new law is that any lawyer who takes this and says, this is the new law, any case like that he took, you know, there is he just looks at the Defamation Act and says, look, this isn't going to fly. At the moment, you can afford to take a punt. And people do take punts. And they do take punts. Every week, I can tell you, they take punts.
I mean, under that, Chair, you'd be relatively confident, Mike, that it wouldn't, that it would have stopped that type of fictitious thing in its
We'd still have to spend money.
Track.
If it got to, I think I'll just make it one small point of it, which is the point that says, look, at the moment, we do have a lot of people having a go. And they're not always the little man, you're right, it's not always the little man, but it's people having a go. And we've got one going through the case at the moment, which I can't talk to you about, but I can assure you it's true, of somebody having a go when I say having a go. And we're already incurring quite substantial costs of our own lawyers and their lawyers, and, you know, we will continue to fight it. In the end, what we might do on this one is we might have to say, right, we will give you a very small amount of money, and it's not because we think we're wrong, it's because they're determined to go to court, absolutely determined to go to court, and we will start racking up thousands of pounds a day to defend that. And that's a chilling effect on our industry, you know. And what I'm saying is that this law stops that in some senses.
and gives you some regulation or some place to go with the new internet. And maybe say I'm declaring interest that I'm a regular contributor to your debate NI side. Stress that it's unpaid. But,
not even a commission for Basel?
It all goes to that. But you know, at the minute, all our laws are looking, you know, half a century ago, effectively, that you're working on.
Absolutely. Yeah, and I think this thing, particularly on the fact that everyone's a publisher now, you're a publisher. You know, I mean, what this actually does say, John, and perhaps I shouldn't say this, is it says that actually, if you said something about someone that someone thinks is defamatory, we're protected because you're the author.
Yeah.
But you know, again, that's another thing. If all the comments underneath your columns on those pages. Now, we know that some of them can be brutal. The commenting community they're not always the most rational people. Not always. There's a lot of what we used to call the green ink brigade out there. But what it does do, when you've got all this plethora of information that you really can't control, and that's the life we live in now, it actually gives some protection to the people who are hosting these things in a much clearer way, and also to the tweeters and bloggers who blog out there in their back bedrooms.
Yeah. Thanks, Chair.
Okay, so. Okay, members? Okay, Mike, thank you very much for that. Moving on, members, to the next session. Can I refer you to the following papers? Document from Mr. Mike Nesbitt regarding the consultation on defamation laws at pages 51 through to 90, and correspondence from Mr. Paul Tweed on defamation reform, pages 91 to 92 of your packs. Mike, you're very welcome back to the committee again. Do you want to give us a brief update on where the legislation now stands?
Yes, thank you, Chair. Perhaps three things: activity that I've undertaken since I was last with you, next steps, and thirdly, how the entry of the Northern Ireland Law Commission is impacting on from here on. So, since I was last with you, Chair, I opened a 10-week consultation in mid-September, primarily as an online survey, 10 questions largely based around the key changes in the 2013 Act for England and Wales. The response was good. Mike Harris, who you'd be aware of from the Libel Reform Group Index on Censorship, said incredibly there was a bigger response to Mike Nesbitt's consultation than there was to the Ministry of Justice's consultation covering the whole of the UK. Something over 200 people responded online with a couple of dozen separate emails. So of the 10 questions, number 1 was, should we bring in this serious harm clause which would raise the bar in the hope of knocking out vexatious claims. 96% were in favour, only 3% against. Question 2 was whether common law defence of justification should be replaced by a statutory defence of truth. 90% in favour, 6% against, the rest don't knows. On honest opinion, an issue Mr Girvan raised a moment ago, 3 tests of honest opinion. Number 1, the statement complained of was clearly a statement of opinion. Secondly, that within the statement there was an indication of the basis for the opinion. And thirdly, a test that an honest person could have held that opinion on the basis of any existing facts or privileged statements. 90% were in favour of that and 3% against. Question 4 was a new defence of responsible publication on a matter of public interest, 97% in favour, 1% against. Question 5 was this question of the operators of websites and trying to separate out whether the operator should be responsible or whether the person who had actually authored the post should take responsibility. 90% in favour of the proposals, 5% against. Peer-reviewed statements, which you've discussed in the session already. A very high response rate in terms of approving of this new defence of peer-reviewed statements. 99% in favour. The single publication rule, to repeat somebody suing and suing and suing. 87% in favour, 4% against, quite a high proportion of don't knows.
Maybe just interrupt you saying, just so I'm clear in my mind, in terms of single publication, how would that actually sort of work? Just what's the intention?
Well, what you would be saying is that if you discovered that a statement had been published and you sue, that's fine. But then if you say, well, somebody else has retweeted it and it's appeared somewhere else, and it's the same thing, you would have probably, say, a 12-month limitation on your ability to sue.
But does that mean, for example, if you got, I'm just looking at clarification, say somebody did say something libelous in a piece, be it in a newspaper or online or whatever, and say you successfully sued from that libel point of view, would there then be any restriction if somebody simply repeated the libel 12 months down the line? Would you have no right to sue under those circumstances?
No, it's if you're finding it after 12 months and it's in one paper and another paper and another paper and another paper. It's simply to stop somebody repeatedly suing over the same issue.
Say for the sake of argument, sorry, I'm just trying to get them. If, say, the August Belfast Telegraph published something which was libelous against somebody, would there be anything to stop them then under that circumstances if it was found against them repeating that 12 months down the line?
No, I think the legislation I would envisage would allow you to sue again, but it's the question of the defamation is made, and then, as is the way with social media, it goes out like a ripple. That you only have the one opportunity on that. You don't sue every ripple. But if somebody comes back and makes it as a fresh allegation, then you can go again.
Okay.
So there would need to be a legislative
Sorry,
distinction.
I think
So libel tourism, this is a question of saying that a judge might say, well, look, this comment is defamatory, but it was viewed, for example, only 1,000 times online within Northern Ireland, but 100,000 times in New York State. Therefore, you must take your case and sue in New York State. Number 9, trial by jury. This is where the response was least favourable. The question was, should defamation cases be tried without a jury unless a court orders otherwise, down to 77% in favour, and that may reflect the fact that we have particular views in this jurisdiction on non-jury trials, going back historically. Number 10 was a sort of catch-all. Do you think we could do better, or is the current set of laws as good as it gets? And 1% thought the laws are as good as they can be. So Chairman, my intention was to move on from that public consultation to a round of consultations with, as it were, super consultees, the chief stakeholders. But as we know, the Minister has asked the Northern Ireland Law Commission to take a view. So I've spoken to them twice, and we reached a mutual understanding that they were going to do the same thing. So there was no point duplicating. So I agreed at the end of the first meeting that I would return with these results. So they're now in possession of the results of my public consultation, and I am standing back to allow them to go into the next round of consultation. As I say, there's no point duplicating the two things. My one concern, I have to say, is the timeline. At my first meeting with them, I left with the impression that it might be done before summer recess. After my second meeting, I fear it might be summer recess next year. It is not a criticism of the Law Commission. They will do it thoroughly. They have issues, not least in resourcing and getting the right personnel on board, and they currently do not, or they didn't, sorry, when I spoke to them a couple of weeks ago. So they will do it thoroughly and properly, and I do not in any way offer any criticism of the Commission. But I am concerned that it's being kicked down the road politically. You can look at the Minister's intervention benignly, or you can take a less benign view that it does knock it back.
Are you currently considering then whether you would go ahead with your...
It's my understanding that I would not get the support of the Bills Office while the Law Commission is undertaking its work on behalf of the Minister, who clearly could be considering legislation in this area, depending on the outcome.
But is there a view on what an inconsiderate period of time would be in terms of that process?
Well, I would respectfully ask that you might inquire as a committee as to the likely timelines for the Law Commission to publish its conclusions.
Is reasonable enough, members?
I'm just going to make a comment on that last point, Chair. I mean, I think you should get support from the Bills Office, because the Minister hasn't stated whether he is or he isn't. And in fact, the latest, the most definitive position we have as to where the department stands on this is that that they weren't accepting the legislation when they were offered it through a legislative consent motion. So, I mean, my understanding of the bills would be that if there was something in progress, you wouldn't get support. So I would hope you would pursue it with the Bills Office to see is there support coming. Also, maybe just to go back to a point and discussion you had with Peter over the clause about when you could sue or redo that. I'm assuming if that banned someone, if they did take a claim against somebody and the courts refused it, that you couldn't then, if the allegation, you couldn't try your luck with a different claim or a different, against someone different, just go again. Is that where your 12-month rule would kick in on that, trying to stop people reclaiming? Would that...
I think one of the issues, John, is that if 12 months have passed and you haven't sued, the question then is, what serious harm could possibly have arisen to you? That it's been out there for so long and you've either been unaware of it or aware of it and haven't bothered to take action. That would suggest it has not caused you any serious harm.
Right. Thanks, Chair.
Peter, you wanted to?
Yeah, no, I mean, I'm still probably trying to get my head around some of that side of it. But, I mean, I'll not rehearse the arguments again, because obviously we've been saying this. Just in terms of the consultation, you got 209 responses by way of the email test bit, and then you said you got was it a couple of dozen that were sort of like... Were those accompanying emails to the thing, or was it, whatever you said about the couple of dozen?
They were sent separately to a separate email address that I'd set up.
In terms of the 209 that you got, do you have any sort of data on how many of those came from individuals or how many came from organisations?
No. that, in the same way, you book a hotel and you hold a public meeting, you can't really verify who's come and that they are who they say they are.
Well, I appreciate that. Well, that point of view, I mean, do you have any form of postal addresses of people, or is it just an email address of anybody that's...
No, it's an online survey. You don't register. You just fill it in. So
I'm just wondering, because I remember, to take an example on a different sphere on it. I give an example maybe from my own area, which was contentious in a different way, I suppose, where there was plans to local paper did a thing with sort of an online survey, which was to give people's views on what should happen in terms of the seafront of Bangor. And I think it ended up in the end with, if you take it at face value, I'm maybe slightly misquoting the figures, I can't remember exactly, but maybe like 12,000 in favour and about 12,000 against. And clearly there have not actually been all that many people who have been on, but you had some people who were very, very driven by the issue, who had then done multiple responses, multiple emails. I mean, what's to say, I'm sure this isn't the case, but what's to say this isn't three people in a room who feel really passionately about a particular issue, keeping on if I so desire, it's easy enough for somebody to set up 20 different email addresses or 100 email addresses if they so desire, even if they want to have different email addresses. I mean, what's to say this is 209 people as opposed to...
One person 209 times? I suppose it's possible. I mean, it is what it is, and it would not, to my mind, be the definitive justification.
You're getting very cynical in your own.
Well, I mean, I'm just wondering, I suppose, on the other things, whenever, for instance, taking your statement around this, you said, or to be fair, maybe it wasn't you, it was the way it was picked up in the papers, talked about 99% of the public back you on that regard. Now, if it's 209 responses, presumably we don't know the breakdown as to whether those are from Northern Ireland or how many are from outside of Northern Ireland. There will be people who feel, on different sides of this, feel very passionately about particular, almost any issue you can pick out, there will be people who feel very passionately as to whether even this is 209 or whether it's, maybe sort of sake of argument, say 100 people and a number of people sort of keep on multiple sort of...
I think it's a reasonable point, but it's a broad point about how we consult with the public. And as I say, I would never have argued that this should have been the defining document that would bring forward the reform of the libel laws. I think the round of consultations with the likes of the judges, the judiciary, the Law Society, the Bar, these are the key stakeholders.
In-depth stakeholders.
Yeah.
Just again, just to see whether I detect from what you've said in terms of, because there was, like a qualitative difference, at least, albeit I appreciate it was a fairly heavy backing on the basis of what was there. In terms of the one issue of the jury trial side of things, and I detect a flavour, at least from what you've said, that you're either reconsidering or possibly backing up that aspect of things. And I mean, just wondering maybe if you clarify.
Well, I think I've taken the view from the beginning that what I would like to see is reform of the libel laws, but try to be flexible about how we accomplish that and have an open mind about what is right for Northern Ireland. And I think from the start, the idea of denying people or in any way restricting jury trials, I think you could have predicted that was going to be an issue, and to the extent that this is robust evidence, it is there, that you drop from 90s, high 90s, to below 80% in favour.
So I suppose it would be a fair comment to say, obviously, you're very supportive of all the elements of your bill, quite naturally in that regard. But obviously, you're sort of a little bit in listening mode as well, and that sort of thing. That's probably the one aspect you're perhaps, fair to say, most open-minded about, or what will
within those 10, absolutely, because what is the right balance between doing something efficiently, effectively, and quickly, and doing it really, really well and thoroughly. So there may be, it seems to me, the logic of it would suggest there would be times when you would want a jury trial, and other times where it might be reasonable to say this just needs to be done, action quickly by a judge.
And I suppose just a final point, just to ask, and it again came. I mean, I'm just trying to see. As mentioned, was obviously made with the other mic a minute or two ago. The issue, which I suppose arguably does not go directly to the libel definition side of it, but it's quite often seen as the elephant in the room as regards libel, is the barriers to people taking libel on the basis of the cost side of it. I'm just wondering if you have any thoughts of either incorporation or how you could. I mean, I appreciate the general argument is made that if you clarify and simplify things, that will have some level of impact, but from a practical point of view, it still is leaving someone who does want to take a liable action, and if it is somebody who's not very well off, they're taking a tremendous gamble with very, very large amounts of money, and that, to use the word, creates a level of chill factor for that person. I'm just wondering, do you have any thoughts on how specifically you deal with the issue of the barriers on the basis of cost, and whether that's something that could be incorporated into legislation?
Well, something that I've looked at, but I wouldn't claim to have the expertise in terms of how you could make it actually happen, is the kind of no-win, no-fee type arrangement that exists in England for certain aspects of the law. I listened very, very intently to your exchange with Mike Gilson on that, and what I would say is I would certainly support anything that you were suggesting that could remove that chill factor and make it access to this particular type of law open to all.
Maybe something whenever I think it's a reasonable bit to check with the Commission as to what their sort of timescales are, but it might well be then if there's legislation being brought forward on that side of things, it may be something that could be incorporated within that. But
well, I think as a matter of principle that would be very welcome.
Okay. Thank you, Chair.
Okay, thanks very much, Mike, and no doubt we'll be back for the committee in the future.
Hope so. Thank you very much, Chair.
Thank you. Okay, members, can I ask for your agreement that we write to the Law Commission seeking an update on its review and to establish an indicative time frame?
Great, yeah.
Great. Thank you. Any further information that members require around the bill? Peter?
No, great. I would back on board, although I wouldn't. I'm not sure there's necessarily a need for changing this, but I think as the Chair raised earlier, whether there's an indication of how the issue of deceased persons is dealt with in other jurisdictions, I'm more than happy to obtain that information. I wouldn't personally advocate changing that, but I think it'd be useful to get that information.
Can we seek that information? Yep. Members agreed?
Great.
Okay, we'll move on now to item number 8, subordinate legislation. And first item is the Principal Civil Service Pension Scheme Amendment number 2, Scheme NI 2014, and refer members to the copy of the letter regarding the Principal Civil Service Pension Scheme. It's at pages 94 to 96 of your packs. This amendment is consequential and is not subject to any assembly procedure, but is merely provided for noting. We move on to SL1, the Pensions Increase Review Order in Northern Ireland 2014, and can I refer you to the copy of the SL1 letter and draft statutory rule document regarding the Pensions Increase Review Order in Northern Ireland 2014, pages 98 to 105 of packs. This order is not subject to any assembly procedure and is merely provided for noting. We move on to item number 9. There are no comments on those. Correspondence, and ask the clerk to highlight any correspondence that we may need to act upon.
Chair, there's quite a large body of correspondence in the pack this week because there's a rollover from last week. Just I'll pick out some items that require decisions, and if members have any other queries or items that those can be raised. The first item, Ulster Bank have responded to the committee's queries around its future intentions in terms of Northern Ireland branches, etc. Arising from correspondence from an employee that the committee had received. So that's at page 108 of the pack, and the bank is advising that they're currently undertaking a review of the network of 79 branches in Northern Ireland, and it's recently announced additional services to customers in the 482 post offices, and it's also advising that once it has concluded the review and informed staff and customers, it would be happy to engage further with the committee. Now, the members will be aware the ETI committee is holding a session with Ulster Bank on the 10th of April and has invited members of this committee along. So it's just really to check if you wish to copy this correspondence both to the employee who had raised the original correspondence and also to the ETI committee for information in the meantime. Sure.
Yeah. Great. Thank you.
Then at page 109 of the pack, there's a letter from the Minister. It's after each of the Chancellor's statements and budget statements, the committee normally receives this type of update in terms of the implications for Northern Ireland. So it sets out briefly there the implications of the recent Chancellor's budget, and it's just to check if members are content enough to note, or if there are any queries that require further correspondence, or if they wish to receive an oral briefing, or happy enough just with the correspondence.
Members wish to receive an oral briefing on the budget impact.
I think it might be helpful because there's a couple of areas there will have a negative impact upon.
Okay.
Okay.
Take that as agreed. Thank you.
Agreed.
Then at page 113, there's correspondence from the Northern Ireland Human Rights Commission regarding a recent report that was published on public procurement and human rights, and I went along in place of the chair. There was a plenary call that day, Chair, and that's there was a representative from the Human Rights Commission in England who, for example, set out practical examples of gaps in terms of human rights and public procurement, for example, around, they give examples of care homes, residents in care homes, and other examples that had been audited. So there is an apparent gap, and the report is now published, so it's just to really check if two things: if the committee want to receive an oral briefing from the Human Rights Commission, and secondly, if the committee wished to get a DFP response to the report. There were DFP officials at the event that day.
Okay, so we can either have a written report from DFP or an oral briefing from the Human Rights Commission.
Or both, Chair.
Or both.
I think we should start with the DFP one.
Okay.
Not go back.
Members content?
Yeah.
Okay, thank you.
Okay, and then Chair, at page 170 of the pack.
Yeah.
It's correspondence from the Agriculture Committee just in relation to the recent session that the committee had on measuring well-being, and that committee has noted that the report from the Carnegie Trust didn't have any specific references to rural or farming environments or measures in that regard, and is just seeking a response on that issue. The committee's content that issue could be raised with the Carnegie Trust, Chair, and just a response directly to the Agriculture Committee.
Yeah.
Members content? Okay, thank you.
Then at page 171, there's a follow-up research briefing on the issue of financial transactions capital. Members will recall there were a couple of issues the committee wanted the researcher to follow up on. One was in relation to the repayment terms, and the other was in relation to whether the executive could retain an equity interest in projects after repayment. So those two issues were pursued, and there's a couple of follow-up suggested issues that the researchers identified the committee may wish to raise with DFP, but there's clarification on both of those points, Chair. If the committee's content enough to forward that on to the department.
Yes, members agreed?
Agreed.
Thank you.
Then, there's a draft response. There's various pieces of correspondence from the OFM-DFM committee regarding its inquiry into the Barroso Task Force.
Inquiry.
And there's a draft response from the committee at page 208 of the pack.
Page 208.
Basically, Chair, it's just DFP has advised that it has an advisory role in respect of the Barroso Task Force and isn't responsible for the drawdown of funding. So it's the response just highlighting that point, and also referring to some previous work the committee has undertaken in terms of the task force.
Do we have no oversight of that money then that is drawn down? Is there no oversight of it through DFP then? That's my understanding of just what you said there.
It's a good question. Could be put to the department in terms of an overall, across all departments, of all the money that's drawn down. Could be raised with DFP.
Okay, can we seek that information?
Because I have concerns I have serious concerns about some of this European money, how it is dealt with through the department it's geared to. Appreciate that they have to make a spend within a ring-fenced area or whatever that might be, but the fact of the matter is we should be able to make a calculation as to how it affects other budgets or how we've allocated money in other budgets that might be duplicating what is currently there coming from a European perspective.
Okay. Yeah. So we'll take that information. Members agreed?
Agreed.
Thank you.
And then, Chair, there's correspondence, further correspondence on the issue of the Northern Ireland Prison Service drug testing contract that had been raised by Randox Laboratories, and that's at page 229 of the pack.
Yeah.
Further correspondence from Central Procurement Directorate. So it's just highlighting that the arrangements for the committee had queried when the contract had been put in place, and also how many Northern Ireland companies had benefited from the contract. And there's clarification it was put in place in September 2009. It's pointed out that it wasn't a framework arrangement, and also that the Scottish Prison Services advised that 10 companies tendered for the contract. Randox was one of the 10 bidders. So it's just to check if members are content to copy that both to the Justice Committee, because it has also been looking at this issue, and also to Randox for information.
I asked what's meant by the term not a framework arrangement.
Sorry?
This is not a framework arrangement.
Yeah.
This is the link with Scotland on the same tender of the project.
Well, presumably it means it's done on an individual basis for Northern Ireland rather than as part of a framework for Northern Ireland and Scotland and Wales.
That seems a little bit peculiar, since we both appointed the contract at the same time and it has run for the same length, same period, and hasn't been tendered to either party. And I'm talking about this from, and I'm speaking as Mitchell as well on the issue, Randox being within my constituency, having concerns about the way it has been done, because they believe that it is linked
to framework. Okay. Is there any further information we can get on that?
Back to the Department Chair asking for further clarity on that, what they mean by that it's not a framework, because Randox, as members said,
there seems to be an indication that the contract is a shared contract.
Okay, we'll do that, Paul. The next item, NAMA.
NAMA, Chair, has the committee had written to NAMA asking if it would be prepared to provide a briefing on its Northern Ireland operations, and it's come back at page 234 of the pack to say that we regret that we are unable to accept your invitation at this time. So it's just to check if the committee want to go back to ask, well, when would NAMA be in a position to come to the committee?
I think that would be a good idea.
They're being bought over though, aren't they?
Yes.
Is that the problem? Maybe the problem.
There's some media speculation about the Northern Ireland operation.
Adrian?
I think it would be good if we can get a clear indication from NAMA what actually they own here on a county-by-county basis, because, you know, nobody seems to know, and I've been involved in a couple of things for constituents lately who've been trying to buy property, and it turns out that they're owned by NAMA. They don't want to sell them. No matter if they're getting an asking price or they're being advertised at, you know, and it's, the whole thing's a bit strange. And I think it would be very useful. It's not going to bring up under any other business, but you know, do it here. Can we write to them and ask them for that? Could they supply us that information at least?
I'm sure we can write to them and ask them.
I'm sure we'll not expect to get anything back from them. Information talking about. So I think it's worth it there.
No, we can't give you that. It's commercially sensitive.
Well, it shouldn't be commercially sensitive, just merely to state what they own and where. But one of the concerns at the beginning about NAMA was that they would start selling off their portfolio in a fire sale, and that would have a hugely negative impact on the market here. But anyway, they didn't do that, and we are where we are. So we'll do what Adrian has asked and request that they give us a future date, an indication of a future date. Okay, agreed? Great. Thank you. Next one is OFM-DFM Committee.
Yeah, it's just an invite, Chair, from OFM-DFM Committee to the European Economic and Social Committee presidency launch on the 3rd of April. I think that's Thursday, 3rd of April, in the members' dining room for either yourself or the Chair.
Okay. Thank you. And then we have the committee forward work programme. pages 29 to 32 of table packs. Members content that the work programme be updated to reflect any agreements made today and that it be published on the committee website. Agreed.
George, I presume, by the way, and I'm not disagreeing with it, it's quite sensible. 21st of May, I presume that's been kept blank because of the fact that it's before the elections and anticipation of a difficulty with quorum and that type of thing.
Yeah, Chair, would be maybe helpful just today to the committee make a decision whether they want to just not have a meeting on the 21st.
I think, Chair, I suspect
No
all of
agreement
the
for
different
that.
parties will be pulled so many different directions that day. It's probably.
So we're agreed that there will be no meeting on the 21st.
Agreed.
Okay. Thank you. And the date and time of the next meeting will be the 2nd of April, 10 a.m. in room 30. Members content. Committee now adjourns.
Northern Ireland Assembly, Committee Room 30. This is